tie tukinyonge ngima kaloka yamo ngima kaloka yamo kawono intie tukinyonge kawono intie tukinyonge ngima kaloka yamo ngima kaloka yamo kawono intie tukinyonge kawono intie tukinyonge oya ore oko owete di manyo pesa oya ore oko nyimine di manyo pesa to seche moko owete Bena malongo mudi manyo pesa kende ayaye oya ore huko mapenzi yetu adua ketelela yeyera jogari jogita manigi pesa bundete yeyera huko mapenzi yetu adua ketelela yeyera jogari jo pesa manigi pesa bundete yeyera Aoko mapenzi yetu adua ketelela yeyera jogari jo pesa manigi pesa bundete yeyera Aoko mapenzi yetu adua ketelela yeyera jogari jo pesa manigi pesa bundete yeyera Aoko mapenzi yetu adua ketelela yeyera jogari jo pesa manigi pesa bundete yeyera Gima kaloka yamo Gima kaloka yamo kawono intie tukinyonge kawono intie tukinyonge Gima kaloka yamo Gima kaloka yamo kawono intie tukinyonge kawono intie tukinyonge apese yudo nyathi maler okwonde mora apese yudo nyathi maler okwonde mora udu kinyo nyathini ler okwonde mora udu kinyo nyathini ler okwonde mora nyakwaro bunge nyathini ler okwonde mora nyakwaro bunge nyathini ler okwonde mora Cinderella chung to chwako chai kurwako sikati tarwako tai mitakulungore jirende chwanyore mitakulungore jirende chwanyore ngamalo ionge nyiri duto imayo kompe ngamalo ionge nyiri duto imayo kompe aweyo nyiri mawuonda aweyo nyiri mamadha aweyo nyiri mapima etimbe magalagala kubulus siro mamanya manya kubulus kongogi njaga kubulus baby aweyo te msupa aweyo te baby oh inego gachuga kiviga kulo dendio inego gafiga itweyo kulo imiyoga pile gimonyolau indisori dendio romolau imiyoga pile amanyi katamdo lil tadwari
Go by the name of Pesi aka Mnyama Mkali.
Sechimatumo donjewi 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 Mielam Sechimatumo donjewi Sechimatumo donjewi Sechimatumo donjewi Mielam Long time ago, many years ago, women knew their places. Men knew their places. Children knew their places. Sechimatumo donjewi Sechimatumo donjewi Mielam Sechimatumo donjewi Sechimatumo donjewi Sechimatumo donjewi Sechimatumo donjewi Mielam Long time ago, many years ago, women knew their places. Men knew their places. Children knew their places. No man should beat a woman, and no woman should beat a man. Long, 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 long time ago. Many, many, many years ago. Such a matumo donjawi. Such a matumo donjawi. Miela, 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 miela. Long, 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 long time ago. Long, long time ago. Women knew their places. Men knew their places. Even children knew their places. Such a matumo donjawi. Such a matumo donjawi. Miela, 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 miela. I go by the name of AKM Nyamamkali. You can follow me on all social media platforms. I come from Kisumu, Pacho. So I want to take you back to Kisumu. Ayo, yelele aye, siro akeli Kisumu. Area wasituna, the only flyover in Kondele, the only virgin in Entebbe. The only mbuta inobunga. Nataka tuwe wewe Nyeri, nilete wewe Kisumu. Via international airport, the land of Lupita and Obama. Eyawa hasutuna, the only flyover in Kondele, the only virgin in Entebbe. The only mbuta inobunga. Nataka tuwe wewe Nyeri, nilete wewe Kisumu. Via international airport, the land of Lupita and Obama. Jambo, jambo siro, jambo siro. Habari yako mzuri sana. Jambo, jambo siro. Habari yako mzuri sana. Tapeleka wewe Lake Victoria, twende na boat kidogo, ituzunguse hadi hotel wani, wachamgege gikuo. Hey, yawa babona, the only fish in Lake Victoria, the only hippo in Hippo Point, the only impala in Impala Park. Tapeleka wewe Lake Victoria, twende na boat kidogo, ituzunguse hadi hotel wani, wachamgege gikuo. Hey, yawa hasutuna, the only flyover in Kondele, the only virgin in Entebbe, the only mbuta inobunga. Nataka tuwe wewe Nyeri, nilete wewe Kisumu. Via international airport, the land of Lupita and Obama. Jambo, jambo siro, jambo siro. Habari yako mzuri sana. Jambo, jambo siro. Habari yako mzuri sana.
Yo, Asiro will take you to Kiboko Bay from sunset to sunrise. Usiku tulala zetu telie
Apesi mnyama mkali.
So ping nipeleke wewe Kibuye Jumapili dong chenchiro Ya yasiro enjoying our beautiful Kisumu Jambo Siro habari yako nzuri sana Jambo Siro habari yako nzuri sana.
Siro talks about peace. Umejua imekuwa for so long Kisumu imekuwa after post-election kuna post-election violence. So tunajaribu tu kutel watu Kisumu ni poa, Kisumu kuna vitu freshi, kuna amani pia unaona, but kuna few people lazima wa change mentality. Nasema vijana ndio lazima tu change mentality yetu, because unapata politicians wana to use sisi vijana because maybe tuna jobs na many reasons sana. So tunajaribu tu kuambia watu Kisumu ni poa, hata huyo Njeri ama Shiko anaweza kuja Kisumu na still a survive because environment hizi. Tumeanza kuchange Kisumu. Naitwa Apesi, mnaweza ni follow on Facebook, Twitter, kila mahali Apesi mnyama mkali.
Najenga nchi lakini nchi hainijengi. Napata kukula lakini si daily. Najenga nchi lakini nchi hainijengi. Napata kukula lakini si daily. Niko na watoto wamelala na deni, na kesho I don't know kama nitapata deni. Niko na watoto wamelala na deni, na kesho I don't know kama nitapata deni. Mwananchi ni nani? Huyo masikini. Mwananchi ni nani? Deni. Mwananchi ni nani? Huyo omba. Mwananchi ni nani? Gara. Mwananchi ni nani? Huyo masikini. Mwananchi ni nani? Deni. Najenga nchi lakini nchi hainijengi. Napata kukula lakini si daily. Najenga nchi lakini nchi hainijengi. Napata kukula lakini si daily. Niko na watoto wamelala na deni, na kesho I don't know kama nitapata senti. Niko na watoto wamelala na deni, na kesho I don't know kama nitapata senti. Mwananchi ni nani? Huyo masikini. Mwananchi ni nani? Madeni. Mwananchi ni nani? Huyo omba. Mwananchi ni nani? Deni. Mimi mwenyewe nalipa ushuru, nchi naishi hakuna uhuru. Wa taifa ndio kuna nguvu, tunadanganywa na giza na nuru. Mimi mwenyewe nalipa ushuru, nchi naishi hakuna uhuru. Wimbo wa taifa ndio kuna nguvu, tunadanganywa na giza na nuru. Najenga nchi lakini nchi hainijengi. Napata kukula lakini si daily. Niko na watoto wamelala na deni, na kesho I don't know kama nitapata senti. Niko na watoto wamelala na deni, na kesho I don't know kama nitapata senti. Mwananchi sasa mfungue macho, tuna tribe mbili tu, rich and poor. So soma sheria na uifuate. Mambo ya serikali saidia, serikali saidia, Mungu ndiye anaweza kukusaidia. Nikome watoto wamelala na deni, na kesho I don't know kama nitapata senti.
The song inakuuliza tu mwananchi ni nani. Kwa macho ya kawaida mwananchi ni nani? Mwananchi ni maskini. Mwananchi ni ule mse ako huko kwa jua kali anafanya kazi ngumu na get. Na kuna mabwenyenye maybe wamesit kwa au kazi yao ni kukaa kwa parliament na kutudhulumu na kutuuse sisi. Shukran sana, nitarudi tena.
Mr. Pesi, for that very, very wonderful performance. Yani the fresh siro imestick kwa head. Maybe tunaweza ongea one or two things.
Yes.
So wewe ni mkaji wa Kisumu ama vipi? Nimeona unaongelea sana Kisumu.
Nimezaliwa Kisumu, naishi Kisumu. Na kuja kazi tu Nairobi.
Ulisema ati the only hippo in
Hippo Point.
The only hippo in Hippo Point. But I'm more interested in the discussion that you had, or rather you said something before one of the songs about watu wame stereotype Kisumu, that Kisumu is a violent place. In fact, even I think a lot of people erroneously say that the communities that are predominant in Kisumu or the Nyanza region, they are violent people. What do you think about this kind of branding?
I can say, you see, kuna vitu zime happen because unaweza kuwa na bad history but uko na ability ya kuchange the future. Okay, for true ama for real, imekuwa that Kisumu iko resonated to violence because most of the youths ndio wanatumika, but tunajaribu kuchange, tunasema art for change, na get. So from kipaji zetu ama from whatever strength tuko nazo, tunajaribu kuchange the city. Na ni mentality. Alafu kunanga kitu mbaya kama mtu anakuja na mentality mbaya. Ukijulikana ni mwizi, ni ngumu uconvince msee that manze mimi nimechange, una get. So it requires time. Na mimi believe change ina take time, una get. Na kuna a lot unafaa kufanya. Kuna a lot inafaa kufanywa Kisumu sana because mimi naweza geuza maybe 10 ama 20 people ama 30 people, but imagine watu wote wenye wako hapo kuambia like this is not the thing, ndio kitu inafaa tufanye.
In fact, and as an artist unajua uko na a unique platform, and like yesterday we were having gumzo, tumekuwa have panels since Monday, and yesterday we had 2 panels in the morning and afternoon, and both were examining issue ya vile tunaweza tumia creativity ama innovation ku kind of inspire social change. So as an artist, tunaona you are in a unique position because unaweza ku reach masses. So I'm just wondering, wewe, do you deliberately use your art, yani kujaribu ku create these social changes? Because artists wana approach art yao very differently. There are some people who maybe they are purely commercial artists. There are others who are maybe purely activist artists. Squeezy tunaita activism. What's your view on the necessity ya kutumia art, to impact society or to inspire social change?
Mimi kwanza na thank God place nimelelewa, nimekuwa brought up in a slum setup inaitwa Bunga, Kisumu. Maybe most of you ni famous
Bunga. Watu wa Bunga, kuna watu wa Bunga hapa. So
you get that in Bunga. If kama sijasoma nikafika college nikapata job, ama pengine nimefika college ama nimefika uni but sina job, nita end up nimekuwa either mwizi ama drunkard, because kuna some of my relatives end up hivyo. So na kuna venye tunaweza change your mentality. First lazima tuambie vijana, mjua na mimi kwanza mimi usema 844 system imetufunga sana. You get that mentality yetu ni usome 844 then upate job, but at the end of the day unasoma hiyo 844 but still hauna jobs, una get. So mi na use art yangu ku impact society in a different way. First kuna vijana huko kwa wood wako talented sana, wako very talented, but they don't have places pa ku showcase their talent. There's a recent scenario. Kuna friend wangu is a good poet, but at the end of the day ana job, so inabidi end up to crime, na get. So ku convince mseka weo that hata art for change inaweza pay ni ngumu sana, because siku hizi unaona watu wanaingia commercial, wacha tuuze vitu, wacha tu
yani mbogi yenye.
So una get hata ni ngumu for an artist kama mimi niimbe songs, conscious music na isell out, but me believe lazima tuanze na somewhere. So I've worked with different youths kwa place natoka hapo Bunga, wengine nimewaleta kwa art because I'm also a vocal trainer, nafunza voice, and also I write music for people. So at least na impact change kiasi yenye mimi mwenyewe nikikaa chini nione kijana ame change, then I feel proud yani.
Yes. One step at a time. Nashukuru sana, very fantastic performance, and keep using your art for this. Especially say unaona kuna a lot of attempts, to influence my youths from other quarters. And if we don't counter those narratives, sisi kama artists, ama when we gather in forums like this, then unajua hiyo narrative yao inakuwa dominant, and then society inaanza ku trend towards that. So thank you so much for sharing your art today, and nadhani utatuchezea tena baadaye, sio?
Hakuna shida.
Wazi sana.
Nimeshukuru sana.
Asante sana. So we are coming to you live from the Alliance Française. This is the third day of the Democracy and Human Rights Festival. We have been at the Kenya Cultural Center on Monday and Tuesday, and today we are here at the Alliance Française. Our discussion today will be centered around the challenges around access to healthcare, especially during the lockdown. Si wote tunajua that healthcare is one of the things that has really been affected during this COVID pandemic period. We have had the stories of even government resources being diverted from activities that were supposed to ensure people against basically death, in the COVID situation. We have seen even a member of parliament losing their lives simply because a hospital in their neighborhood did not have the right equipment to treat them. We have seen women giving birth on by the roadside outside the hospital because our systems are broken. So today's discussion, we will be having a panel a little later on, moderated by Dr. Kamau, and it will be discussing issues surrounding that. However, this remains the Democracy and Human Rights Festival, coordinated by Forum CIV with the support of the Swedish Embassy, and we have 4 partners: Siasa Place, Power 254, Sauti ya Wanjiku, and Creative Spills. And we would like to really thank the Swedish Embassy for supporting this initiative. We are on the hashtag Democracy and Rights Festival if you want to follow the conversations, and we are also live on the Forum CIV Facebook page. That's Forum CIV, Forum CIV, East Africa, East and Southern Africa. You can check it out. We are live over there, and you can send your comments as the discussion goes on, and we can channel those also up here. We have been having some very passionate and informative discussions over this festival, because generally what we want to do with the festival is to bring together stakeholders and practitioners from different fields so that they can discuss, challenges, and also attempt to devise means that can be used to address issues surrounding human rights, gender equality, and the consolidation of democracy in our country and beyond. So in that same vein, today we discuss the matters health, because we realize that even as much as health is declared as a constitutional right, the access to it faces a lot of challenges. And the challenges are not just access. We have quality issues. We have cost issues. We have people in communities that are marginalized, or communities that are far-flung, or in far off areas from the metropolis that we know. These people, they do not have access to healthcare, and this is a very concerning thing, because after all, health is a direct relation to your survival. So we are at the Democracy and Human Rights Festival. You can use the hashtag Democracy and Rights Festival if you want to engage with us. And thank you so much to the Swedish Embassy and to Forum C for organizing this event, and for Siasa Place, Sauti ya Wanjiku, Creative Spills, and Power 254 for partnering. And those of us who are in the auditorium, please respect the social distancing rules. As you can see, there are certain stickers at the on your seats there. So please do not sit there. And if you need to access the lavatories just outside, you take a ride. And now I would like to welcome an artist who has been with us for some time, Mr. Willy Webber, based originally in Nakuru, very, very fantastic artist. And he's going to share with us a few spoken word pieces as we prepare to have the panel come up and discuss the subjects surrounding access to healthcare during the lockdown period. So Mr. Webber, take it away.
Good morning. Are you happy to be here? You're here to be happy. Both. So I go by the name Willy Webber from Nakuru. Yes. Proud Naxvegan, kabisa. And he's Ed. Yeah. So I do spoken word poetry, but I am more of an expressionist. As I said, all I do is express myself, then people call that poetry. But mostly my beat is social justice. And this piece is called Truth Is. Thank you. Truth is, we don't know where the problem is. But the problem is, we don't know what the truth is. I want you to help me. Truth is, we don't know where the problem is. But the problem is, we don't know what the truth is. Again, truth is, we don't know where the problem is. But the problem is, we don't know what the truth is. So kabla death haijanok na struggles za life kunieka cotton, itabidi tupambane. This is where the truth lies, around this tusidanganyane. Ignorance ni kama kutumia soprano kwa address mataiko issue based. Chuo sikuwa at my best. Mode wangu hakuwa modest. Memory so clear kinita ngombe squeeze natumia sana kujilisha, at least siko zero crest. Drama ya life. Neti saa zingine voice ya actor ifanani na subtitle. Truth ni utaland in trouble, si depending na did umefanya sana kama huna title. Vitu peti ndo zina trend, tumesahau what it feels like ku address vitu vital. Immorality na rule kwa nchi, viongozi walikuwa sworn in kutumia Bible. Naishi kwa nchi na nisaidia kupostpone my dreams. Now the only country I pledge allegiance to ni procrastination. Drama ya life. Ni saa zingine voice ya actor ifanani na subtitle. Truth ni utaland in trouble, sana kama huna title. Nasema vitu peti ndo zina trend, tumesahau what it feels like ku address vitu vital. Truth is, si kila message sincere. Kuna wale who preach peace ku suppress justice. Truth justice, ile peace tuna enjoy na depend on justice. My friends at the high places ndo the law, sisi wengine tuna practice. I don't know what you can do, but together we can do better than this. Wakiuliza sasa mimi tunataka nifanye aje, waambie come, let's do this. Come ni kushovle to overcome this. Repetition in a bow. Niliboeka kuandika piece ya peace, nikaandika kuhusu justice. Thank you. So basically, Truth is a series, yeah, of pieces. So that is Truth is 2. We have Truth is 1, series of pieces on social justice, yeah. Vitu zina happen, yeah. I told a story yesterday why I started writing pieces on social justice. Sema niliboeka kuandika piece ya peace, nikaandika kuhusu justice, because a repetition in a boss, ndio your design. So today I will tell you a story, yeah. This piece is called Dear Dad, yeah. Enjoy. Kabla death haijanok na struggles za life kunieka cotton, itabidi tupambane. Tangu class 4 Daroza Mao ndio mimi nilianza kuchora mistari. Pia nilienda na exercise book hoping one day nitashare one stage na Juliani. Ukabila ilikuwa so rampant. The only clan nilitambua ni uko flani. At times tulikanja for days. Hadi mother angejua nini talami. Mother alihave kukaanga skari ndo ingine i-act kama majani. Life ni combination ya failure na success. Vitu mozi zilikosa meaning, squeeze me uji-impress ndo ni smile ama na smile kuji-impress. Na dream haikuhitaji do kuinvest kama ni capital nilihitaji at the beginning of the sentence. Mama, we made it. You had a dream, I was an engineer, now I can make a constructive sentence. Dream ilianzia Nax to Nai. Sai dream team iko LD, main motive kuji-express. Ukanishow akili sio syllable sana, usistress, usidigress kuwa mdiverse. Wape hata chorus wakidiverse. It's all about the standards wakidai class. You still call the shots, hawezi divert. They accused you of greatness, juni kuite battery, you're guilty as charged. Hawezi die but now that you have wings to fly, speak plain English. You wanna cheat on success, then kiss me, I'm Irish. Nasema fly, ego fly. Hata makanjo mtaani unajua no hooking. Tuna pop out design ya popcorn. Hata Vatican inajua someone else is popping. Dear dad, tumekonka world na word, squeeze na Twitter king. Mama kopoa. Si unajua he who finds a wife finds a good thing. Wale wanaoishi in denial ni kama bado haja realize future is here. Bado na need the next big thing. Apart from wachache, wengi wana appreciate nikisema ukweli, wakatai niko na sauti nzuri. Ironically, mwalimu wangu aliniambia I can't use the same voice to sing. Chuoni likam number 2. But your race ilikuwa the chosen ones. Jana niliota na kwa ndoto kulikuwa na moto na tuliota na wewe. Ambia Kimathi nchi aliacha unity yenye iko bado inapatikana kwa national anthem yenye third stanza, third of Kenyans can't even sing. Squeeze I keep it 100 vile nilirealize ni nyuki pekee. Even wannabes can't sting. Easy. Yeah. So that piece is called Dear Dad. So I want to do one piece. Stereotype piece. It's called These Girls. Enjoy. Yep, These Girls. Yo. So never ask a girl why she is in love with you. More so when it doesn't make you so happy when you look into the mirror, because these girls can be very petty. You see, maybe she's in love with the way you look when you sleep. And if she dare tells you it's because of your personality, then maybe you don't look as good. It is better she tells you she doesn't know why than she has no reason. Because when this girl tells you she has reasons, well, these girls cry. These girls cry when they are happy. These girls cry when they are mad. These girls cry when they are scared. All I'm trying to say, sometimes these girls cry when they're not supposed to. These girls will fall in love with you for the comedian that you are. But once you get into a relationship, you cease being funny. Some of these girls knock on open doors. The way most of these girls have saved you on their phones, only God knows. Well, these boys act funny, but these girls can't tell because they have shaved this. Well, now you know why they can't raise their eyebrows. But these girls have been hit more than your favorite songs have been on replay. These girls go through a lot, but with the smiles they give, some of you can't even tell. I'm here to tell these girls it is well. And when they die, all they deserve is the heavens. Because on earth, they've been through so much hell. Because these girls become mothers. Mothers who give us education. A word some of them can't even spell. Thank you.
Thank you so much, Mr. Webber. These girls, is it a personal experience?
Wewe, ushaiambiwa the problem is me, not you.
See, we have always been the problem.
Lakini akitaka kutoka atakwambia.
Yeah.
The problem is me.
Yeah. I didn't see your calls. Thank you so much for that wonderful performance. And I think it was nice because we can start a little lighthearted. It's like having some coffee in the morning before we get into the serious discussions that we're about to have. And I'm told Dr. Kamau is around. Did you see Dr. Andrew Kamau?
Yeah.
Dr. Andrew Kamau is around, and he's going to be hosting a panel talking about the right to healthcare and access to healthcare during COVID-19. And I'm sure, even as an artist, and I know that you're also very involved in your community. This is something that during these pandemic times, I mean, the weak healthcare systems in our country have really been exposed for what they truly are. Have you seen any experiences, or have you heard of any experiences in Nakuru that could, kind of just inform that discussion as Dr. Kamau comes up in this panel?
A discussion on healthcare.
Healthcare and access to healthcare. It's a human, it's a right. It's actually a constitutional right. But tumeona, even like they were saying, NHIF will not pay your COVID bills. And then we know what happened to the masks. And then we have all these COVID billionaire issues. Then now we are realizing we have about 300 ICU beds in the entire country, that are supposed to serve, 50 million people. I'm sure Dr. Kamau will tell us even the doctor to patient ratio in this country is crazy.
True.
And you remember the situation where some lady gave birth outside a hospital? I'm sure these are things also you've experienced in Nakuru. What's the situation there? You guys have like level 8 hospitals over there.
The situation is bad. I say, viongozi mulipatia kiti, walikula pesa ya COVID. Now COVID imekuja, sasa viongozi mulipatia kiti, wanasema nyi mkishikwa na COVID mnajisimamia. You get? Now, I was filling the form, NHIF, I was transferring hospitals, because I realized, even right now, some hospitals, particular hospitals, it is not working, It is not working. And as you said, the ratio, the patient-doctor ratio, like the public hospitals in Nakuru, you go, you sit there, hadi unapona. Because you see other people wamekuja with other severe cases than you have, and you've been sitting there for 3 to 4 hours. No one is attending to you.
We've even had people die in an ambulance outside a hospital.
Exactly. And healthcare in this country, it is a reserve for the few who have cash. And it is actually very, very sad, because public hospitals are way cheaper, but then you're treated at the mercies of people who are working there. Private hospitals are for people who have cash, and not many people have cash. You get? So it's a reserve for the few.
Tumeshukuru sana for that performance. And I'm always interested in artists being able also to articulate issues in their communities, because for me, an artist also is a public intellectual.
True.
And the only way you can be that is if you have knowledge in your head.
Kabisa.
And then now you can transmit that knowledge. So it's interesting that you started, for example, with some pieces that were very thought-provoking on a political spectrum. And then you came down and you gave us these girls, which is very relatable. And the ladies were saying, hey, Maze, come pole, Buddha.
Kuna these boys.
Kuna these boys. Thank you so much.
And it is actually very good that we are normalizing these conversations and setting the agenda, because information is power. And once we are from here, Apesi goes back to Kisumu, Dofan goes back home, we take this message there. That is how we change. Someone said yesterday, okay, we are not where we want to be, but also we have to appreciate the fact that we are not where we used to be. Yeah, so it's progressive.
Absolutely.
Asante.
Thank you so much. And so I wouldn't want to take too much more time. I'm told that Dr. Andrew Kamau is ready. He's a medical doctor and also a human rights activist. And he'll have a panel of 4, and they'll be discussing issues surrounding the right to healthcare and access to healthcare, particularly in relation to this COVID period. And so I would just like to have the pleasure of inviting Dr. Kamau up here, and then he will invite his discussants and lead the session going forward. Karibu sana, Doc. And Doc was telling me that one of the reasons they have bad handwritings is because they have too many patients. You see, so they have to write very quickly. I used to think that it's because they don't want to let you know you have Ebola. It's just COVID. Karibu sana, Doc.
Thank you. Check. Yes, so my name is Andrew Kamau. A background in health, public health especially. And I'm here to have this discussion with you, just to, with our elaborate panelists, to see, just to explore our right to health. So in the interest of time, I'd like to invite to the stage Njoki Gashanja, please. Please help me introduce, give a round of applause for Njoki Gashanja as she comes up. I'd also like to call Betty Waithera. Betty, karibu. And Nderito Muya. Nderito, tafadhali. And lastly, we have Mr. Stephen Okwanyi. Thank you all for attending. I think maybe we can start our introductions from Njoki's side, please. You need a mic. I'll just hand this.
Good morning, everyone. My name is Njoki Gashanja. I am a political and social justice activist. I also coordinate Githurai Social Justice Center, and I'm also a law student at University of Nairobi. I am glad to be here.
Good morning, everyone. My name is Nderito Muya. I'm a patriot, an active citizen, and I'm also a founding member of a community-based organization called Brain Tank that works in Kasarani, focusing majorly on youth empowerment and mentoring of young people into entrepreneurship opportunities. Thank you. I'm glad to be here.
Good morning. My name is Waithera Wanjiru. I'm a human rights activist. I'm the convener of the Red Vest Movement and also the Grassroots Women Initiative Network Kenya, working with women in the informal settlements and grassroots organizations on matters women rights and also ecological justice. I'm an economic rights activist, and beyond that, I'm a journalist, basically who loves to inform grassroots and also relay the message from grassroots upwards. Thank you.
Stephen Okwanyi is my name, from County 042, Kisumu, working with Talent Africa. I'm a performing artist in theater and film, an aggressive human rights defender for the LGBT persons, and also an aggressive participant in the development spaces within the governance and healthcare framework. Thank you.
All right, thank you for that. And just to kick off our discussion, maybe I'd like to get your initial thoughts when you hear the right to health. You know, when we're at a traffic stop, you tell a police officer, "I know my rights." It can have either, consequences can be negative or positive. But right now, what would you say about the right to health? What's your understanding of your right to health? Any of you can begin, please.
Okay, so so any conversation that touches right to health, when I'm provoked into that conversation, definitely I'll think of Article 33, that is deliberate about the access to unlimited and also high attainable standards of health for everyone. And largely, I'll also believe that we don't go around hawking our rights, because rights are kind of fundamental to everyone. So we don't really put a caveat to any right, like I know my right to, because even the person you're telling, you know your right to, also has a right. Yeah, so the level at which we speak our rights will also be limited to the extent to which it does not provoke or interfere with the other person's right. Thank you.
I think when I hear about right to health, I mean, the new constitution, the 2010 constitution, Article 43 was one of the game changers. And it is, so every time I hear I hear right to health, it really dawns on me how we have failed to implement the Constitution 10 years on, because healthcare is one of the things that are failing in this country. So it was one of the things that, if implemented, would have really elevated the common mwananchi in matters access to health, but that has not happened. So that is what comes to mind anytime I hear right to health.
Well, for me, the understanding of the right to health, first of all, I'm throwing into a number of things into my head when you talk about health. The first one is, since she has talked about access to health as enshrined in Article 43 of the Constitution, I tend to think about this as a commitment. Besides it being in Article 43, and we knowing that health, education, security, and are among the basic, access to basic rights in Kenya. I definitely think about COVID-19, about access, mothers in the grassroots, and how they were able to access services in our hospitals, and definitely the failure of the government today, having in mind that before the handshake, there was the whole issue about the Big Four agenda, whose allocation of budgets it's quite huge. So besides lack of access, I think it's an issue that Kenyans must first come down to talk about in the grassroots, given its essence in our lives. And the kind of political scandals and corruption scandals that have been happening in Kenya, the kind of ingenuity and impunity going on in the country. And of course, right now that we're having a whole discussion on doctors themselves being the persons that we have in our country, young persons, graduates, older persons that are dying, they're not exempted from COVID-19. For me, it's an issue about responsibility from the government, responsibility of the people in the community to ask for those services, and also activists and social economic rights activists being on the forefront to defend doctors and also defend the right to health as a basic right for any person and citizen to live in Kenya.
When we talk about access to health in this country, mostly I get angered, because what should be a right is currently a privilege of the few. What should be, I remember back in school when you're talking about rights and privileges. Rights are basically things that you're born with automatically. From conception to when you're born, You are supposed to have those irrespective, regardless. But in this country, it's exactly opposite. That we have to fight, we have to agitate the government to provide what is basic for human survival is really disheartening. And we are having this conversation, but I wish we weren't. I wish we weren't talking about the access to the right to access to healthcare. That is disappointing for me.
I think I hear a lot of there's a breadth of knowledge all of you have, and also perspective. The right to health. I think also we need to address the right to life. We've lost so many doctors, we've lost clinical officers, we've lost nurses, and just in respect to that, I'd like us if we could observe a 30-second silence, just to honor them. So kindly, let's observe that. Thank you. May their families be comforted in this trying period. There's something that Njoki, you pointed out, and you said, when we look at the 2010 Constitution, that we're not implementing, what was written in the Constitution, and with regards to health. I'd like to ask, was it better before? Is it that the COVID-19 pandemic has accelerated this, or, as we say, exacerbate, as it made it worse? What do you think that the COVID-19 pandemic has unearthed? What has it brought to the limelight that we didn't know, or maybe that we were, let's say, carefree about, or we couldn't point out then? Please.
And I think the saddest part is 10 years on, the Constitution has remained a document that is just accumulating dust. I keep saying this in many places that I go to, that the pandemic is a bad thing, but I think it came as a blessing in disguise, because for the first time, our struggles have been connected. As the low income earners, the informal settlement kind of people, and this middle class kind of people. Because for a very long time, things like healthcare, we from the ghettos, we from the informal settlements, we've had this problem for a very long time. But the middle class people always thought, because there's this false security about insurance, about NHIF, about I can take a loan. Now with this pandemic, we are all in the same boat. NHIF has said, but there, you know what, we can't cover you. Insurance is saying, but there, you know what, you are on your own. The government has said, you know what, you are on your own. So on this one, I actually think the pandemic has come as a blessing, because for one, when Mama Mboga is complaining pale kwa ground, even the person in Mirema, Kile are also feeling the pinch, and so we are activating from the same point of view. They're not feeling like they're privileged and it's not their problem. It's now our problem. It's now our collective problem. When the doctors are hitting the streets, we're not telling them that you people are inhumane, you people don't think about us. We're actually saying, yes, these people have a right to life, these people have a right to be protected even as they're protecting us, and we're joining them. We know that it's going to be crunch time, and it's going to be it's going to affect the whole country, but we're saying, you know what, if we do not unite as doctors, as citizens, we're all messed up. So for one, I think the pandemic has come to expose the state for what it is, a failed state, especially when it comes to healthcare. And I think it is an opportunity for us to organize differently.
Thank you, Jockey. And also just to add, if we look at the strike that had happened years back in 2016, the medics, the doctors were on one front, and the people didn't understand why this is happening. But now, as you point out, that this is unifying people and seeing, they're giving you a peek into their lives. This is what we go through. This is what we do every day, and yet we don't have, these things. Maybe if you can comment, anyone else, feel free. With this right to health, is it something that exists now, even when you bring it home to yourself? Do you have right to health? Do you have that? Do you feel you have the right to health? Or are there barriers? Can we look at these barriers? What are these barriers? And were they more? Were they less before COVID-19? Are they more now? Or, what's the thing? Because COVID-19 has quite been, the game changer here.
Well, if I may, let me imbibe into the discussion from a point of what Njoki is talking about. And I would like to say that COVID-19 has exposed not just our need as the people in the grassroots, our need as a people of this country, the middle class problem, not just our need, but the class issue that is in Kenya. I woke up to a text in the morning by a journalist working with the Daily Nation, and he was asking me why activists are not taking, are not on the front line with the doctors to be at Afia House and all these other places to go demonstrating. And what Njoki has mentioned is something quite important, that this is an opportunity for people to organize. But who is organizing? The activists are organizing the grassroots they have been in, talking about health issues. In the middle class level, the doctors and all those other employed people, because I think doctors are quite middle class people, and class issue is something that we must address as Kenyans to actually even begin having a health discussion, a health conversation on how we move next. You've talked about 2016 issue on doctors. I would like to say that I lost my grandmother to cancer around the same time. 2016, she died in December, but since in that 3 months, we were trying to get places where she could get treated, and she only ended up in a mission hospital. Classism and capitalism cannot go. We cannot talk about classism and fail to talk about capitalism because they're not isolated issues. Capitalism is the system that has exposed the government during COVID-19. What we had was top-level government, protecting themselves and also protecting the ministers and all these other bigger persons against COVID-19 before it got to the mass contagion stage. That took between March and around May for people to start talking about right now hakuna COVID, watu wanatembea bila masks. But really, that was a point where people should have been more careful about their health and actually forming structures in the grassroots on how persons are able to take care of themselves, because the government is no longer interested. And it's no longer interested because of what? The economics. And the economics are very much pushed by what? The capitalistic state in which Kenya and other African states are in. I sat some years back when I was getting into activism, and I sat with a doctor called Dr. Chitai Murambula. And there was the issue of starting a movement in Kenya that we will deal with the Kenyan issue once and for all. And the best example he gave, and I remember very well, was about nurses in Australia, in Brisbane. And there were usually elections, but for the longest time, and this is something that also ails Kenya, when we go to choose our leaders, we do not know who we are going for, or we know, but we, the persons that are the elites, educationally elite, the activists, the people that have interacted with human rights spaces, we have a responsibility of teaching people, but our teaching people, our activating, our being change catalysts can only go to as much as where money get to and extend to. That is why NHIF issue, when Mother Karua stands and says we need NHIF to take care of COVID patients right now, that it's really on the mass contagion stage and anyone next to you. The threats that Mutahi Kagwe was giving on TV, I think they should be very much being used right now, because you go to bus stations, people are not taking care of themselves. So what is the issue? The issue is classism and capitalism. Nurses in Australia went and discussed their issues. The doctors are demonstrating alone, or they do not have activists or faces of people they can see. People are asking me, why is Bonnie not with the doctors today? And I'm telling them, Bonnie said a while back that he's taking a break from activism because we have separated human rights issue from personas from owning them, and that is why it is hard to unite the middle class struggle and the people at the poverty level, and also the people at the elite there. But those people at the elite, they are not stopping daily. They are 4.2 billion lost to Afia House scandal. During the Beyond Zero, those containers, we all know those scandals. And now we had the COVID-19 scandal, which is a very huge part of this country's budget. 2020, the next financial year, there was definitely a budget reading this year, yes, in July. So why are we not removing the issue that is capitalism and classism? Those nurses went to the ballots and they elected their own. Walisema sasa sisi we are tired of dealing with these issues because the Australian government led by the Prime Minister is not dealing with it. They went back to the ballot paper. They went back to the ballots and they elected their own people that understood their issues from that level. So the Kenyan health standards have definitely come from afar. Of course, with the NGOs and all these other key players from the outside. But it's time now for Kenyans to coalesce the essence of socialism and probably just halt for a minute, because we could be headed for a wipeout with COVID-19 here. And on the other side, we are being torn apart by the politics of this country, which definitely we have proven and shown sure that these guys are not ready to take care of its people. That is why it's a reckless problem when we are not talking and organizing to meet doctors. And it's time we do that.
Thank you. I hear a few things that maybe if I could deconstruct, what you just said, Betty. So one, there's the issue of class, socioeconomic class. The second thing is capitalism. And looking at our economy, we're not doing, we're not doing well, and our GDP might reduce, even as a continent. The other thing, though, I would like to ask, which is very interesting that you brought it out, and it's been brought out as well, is access to health in itself discriminatory? Does it draw lines? Are there people who can access health easier than others? Maybe you could just give a gentleman here a chance, and then we could all chip in.
What is coming out clearly is that healthcare is not a right issue. It's an affordability issue. And that's why we are saying, by and large, it's mostly has to do with the access, and capitalism part of it has to do with how financially empowered one is or one is not. That determines whether you get to access health or not, which should not be the case, because if we look at, as I was looking at some data towards this particular forum, Kenya is a signatory to the Maputo Declaration of 2008 that committed to set aside 15% of the national budget to go to healthcare. So far, since 2008 to 2020, that's what, a cool 12 years, we have never gone beyond 9%. And a majority of those funds does not go into the service to the real mwananchi. Most of which goes to infrastructure. I'm not saying infrastructure is a big thing, is a bad thing, having hospitals, having equipment. But far from that, nobody talks about the affordability of this infrastructure. That if we put a diagnostic station somewhere, that the person who mostly needs it will be able to access it, devoid of money or not. And that's a major problem.
Steve, what's your take on this?
Yeah, perhaps if I can just jet in and just put some clarity. I like being grassroots, because grassroots is where extreme violations are affected. So let's take a practical example of UHC. And just talking on the health right aspect. UHC, everybody to a certain level, it became like a talk of the town, and everybody was just talking about UHC is coming to really help. And the pilot counties were actually for Kisumu, Machakos, Isiolo, Nyeri. And Kisumu, where I come from, practically, the biggest challenge was money was dispensed, of course, to the county. And this money could not trickle down to the facility. So now there's a gap there between receiving money and implementing what that money is supposed to actually go to. So it made most doctors really think about if then UHC has brought money and the county also has a capitation, that comes from the national government that is supposed to cushion the healthcare system for like a year before you go to the next financial year. So where did the money go to? You see? So, and just what my colleague is talking about is basically about infrastructure. What then happens to the aspect of commodity, the aspect of information? Because these are also all budgeted for. But you'll find that it's easier for a government to showcase a physical infrastructure as opposed to a social infrastructure. Where investing in social infrastructure will mean making the people much more aware. So that to that extent, there's a very big gap. So where that money goes to is also a question that we should ask. And just talking about Maputo and also delving a bit into like the Universal Declaration of Human Rights and the SDGs, which of course the country and also the counties kind of affirm to the principles. But by and large, you find to a minority community that I represent largely, the LGBT persons, and of course the COVID-19 presenting also a very extreme level of discrimination. You realize that the healthcare facilities have now turned to be no longer safe spaces for persons who identify as minority to access. When I talk about minority, I'm not only talking about LGBT. There's also the aspect of sex workers, also the aspect of persons who use who inject or use drugs. The spaces are very toxic for them currently to access care and treatment, because it's then becoming a space for outing, profiling, and also to an extreme level, it becomes a bit insecure because of the cultural aspect of how doctors are socialized or how healthcare workers are socialized. So if you look at that vis-a-vis investment of the government to offer healthcare, you find there's a very big disparity. Yes, and of course, I'm happy that I'm sitting also with medics here. We sit in forums like this, and we're very progressive in thoughts. I don't know what happens between the spaces we are and the facility where we go to, because when I'll take for example, I come out of here and then I just put on I don't say that people in Kibera don't put on shirt like this, but then I put on a Kibera shirt yenye mtu mwenye anafanya kwa mtaro, and then I come to a facility to ask, and nimekuona tu hapa saizi tukiongea and you're very progressive. Then when I come to the facility, you're the first person to really discriminate. You're the first person to deny service. You're the first person who has resources that's supposed to give me even information, but then you deny. So COVID-19 has made us understand that even as doctors, we have to look at our Hippocratic oath. We really need to evaluate that again and really think if then we conform and affirm to the principles of the same. Thank you.
One thing I know is that I saw something on Twitter today, and there's something who tweeted something. Doctors are not martyrs. You know, doctors are not martyrs. No one wakes up in the morning and says, you know what, I'm going to work in this hospital, and if anything happens, then it's okay. So I think it's also, we should also look at them from a human eye, because they're also human. Maybe before I go to you, Njoki, I want to read out something, just the definition of universal healthcare. Universal healthcare is the goal to give all people access to essential health services of adequate, sufficient quality that guarantees a desired outcome without financial difficulty. Coming from the grassroots, you know, as we've talked even before this session, when you hear that, what comes to mind? What's your experience there?
I think my first reaction would be to laugh out loud. Like, really, that's a joke, and it's a sick joke, you know, because and you see that is a problem when you are detached from the realities of the people that you actually govern and rule. So you will be launching things from the ivory towers and have no idea what the realities are on the ground. Let me give you a picture of what it means to be pale kwa ground. Maybe a ward has one public health facility. So all those people depend on this public health facility, because I mean, you're told in government facilities you will not pay. And so you go there, of course, there's a whole crowd because it is the only hospital there. And woe unto you if it is an emergency, because your person will die there if you do not have money to take them to any other hospital, you will you will queue for hours only to go and meet medics, nurses, doctors who have not been paid for months. So they have their own frustrations. You're trying to bring your problems to them. And this is where I disagree with what he's saying, because you see, we are so focused on the horizontal, what do we call it? The horizontal violence. We don't see where the problem is, because this is a doctor who's not received payment for 5 months, 6 months, and they're here because of the passion, because of the oath that you're talking about. But they are human, they have needs, they have frustrations. So you can imagine you're meeting that person, they've had complaints from 100 people, and the facility does not even have drugs. So they know they will write to you prescriptions that you will not find there. And funny enough, those same people, because because survival, will open up little clinics right outside the government facility. And guess what? They will write that prescription and they will send you there. The nurses, the clinical officers will take the little that is coming to the government facilities, and they will open up little chemists and little laboratories right outside the hospital. And that is where they will send you. Why? Because they're also trying to make a living. You understand? So why the drugs are not coming to the hospitals, why we don't even have enough medical staff in that facility, is not something that the person who's launching UHC is aware about. And I keep thinking, what would it take for you to just one day wake up and go to Kayole Health Center to actually understand what is this that you launch? What would it take? Are you made of gold? Are you some little god that you cannot come to the ground to actually understand the realities of the people that you're talking about? Because what you read there and what is happening on ground is completely different. If you do not have money, your person will die. And people are dying in their thousands, especially in this COVID. Hata utatoka kwa nyumba, unatoka unaenda, you don't have money. So you will just stay there with your fever, and you utasema nani kama niko na malaria, because sisi watu wa ghetto tunakwanga tuna malaria, all through, whether it's a fever, whether unaumwa na mguu, naona ni kama niko na malaria, and you will go and you will take over the counter drugs, because that is what you can afford. At the end of the day, you just die in your house. So even the people that we're counting at COVID-19 deaths, my friend, if you came to the ghetto to understand how many people have died in their house, you'd even be freaking out, because now you say there's free, and access and quality. Quality. What is quality? Pale kwa ground. What is quality? And we are dealing with people who are frustrated. And so it's a whole mess of madness, because I am blaming the doctor is blaming the government, and now we're all dying, even the doctors. So that's, I don't know what that is, but here kwa ground, hatuna hiyo kitu. Yeah.
Betty, please
yeah,
build up on that.
To the different kabisa. It's hectic. In every society, there is two things: the behavioral adaptations of the people, and also the realities on the ground. So behavioral adaptations are as a result of how situations are. The problem is pretty much there, and we all know the problem. The problem is governance and graft. And we can't in the ground expect that you will go to a hospital kama Mama Lucy and the hiyo yenye kwa hapo chini kidogo ni kwa Dio in Kayole, and get tested and get a prescription, And by that, they judge you by your look. If you're in Kayole and you look very poor, you get medicine. If you're in Kayole and you look as if you can have 200 bob for a test. But the cut out of a common person ni gani? The minimum wage is how much per head? The person who is paid the least here. According to the government, what the SRC recognizes as the minimum wage, 12,000, 30,000, 15,000, yes? But there is a hustler, pale mtaani. That person can only afford 3,000 to get treated for typhoid, 3,000 to get treated for cholera, in a relatively middle class, lower income area. Tuingie ghetto. The health sector in Kenya is an enterprise on its own. And why? Because of the capitalistic standards that Kenyan people have been set for by a capitalistic government that cares more about how they're going to fly out, go take care of themselves, come back here, or afford a service in Avenue Hospital. Huko ndio tunachanga sisi watu wa ghetto, watu wetu wakipeleka huko wakiwa na cancer. Hizo hospital tunaingianga watu wetu wakiwa na cancer. Huko ndio tunachanga tunawapeleka. But hizo hospitals, for them it's just, diaper money they're taking there. So the problem of lifestyle and the realities on the ground that even a doctor wants to live a better life because their standards that the society has set is something that is going to make that doctor be rude to a patient who is otherwise very poor. So as we address the problems in the health sector during COVID-19 that has set everything bare for us to see, there is a systematic issue. There's a systemic issue that needs to be dealt with. It's the issue of morals and grafts and our constitution. The issue of sovereignty of the people under Article 1 of the Constitution. The issue of access under Article 43. But access now becomes debatable because the pockets are empty. Yes.
Just building on what you said, Betty, and what Njoki began. So what you're saying is that there's a disconnect.
Yes.
There's a large disconnect between what's done on paper, what is discussed in those boardrooms and this is where we should head, and what the community actually gets, at the grassroots level.
And also, if I can also add, there is also a problem with the doctors. There's also a problem with the doctors, I think from a moral point of view. This is my own view. There's a problem with the doctors for separating their struggles from the common people. Separating their struggle in what sense? When I walk into that hospital, menyamaza, you're not getting paid. When we go out to demonstrate, you're demonstrating as doctors. All right? But we are not asking the people that are suffering to be with us. So I think Kenya needs some kind of radical change that can only be addressed by political, kuondoa how politicians want it, so that doctors can be able to understand that their lack of pay is actually a human rights issue. And probably if they speak out, even before we can go understand their issues as activists, probably if they speak out, help us understand how the system huko ndani ziko. Before you can talk about something, before you can defend something, you must understand in the ways that we talk about the government has failed us. The government is busy taking money from, all these sectors, asking for monies and all these grants from the outside. We must let the doctors first understand what it is like to be a doctor, a clinical officer, a medical practitioner. Because these are the people, again, ambao kwa grassroots, we know are privileged. These are the people I have gone to with a phone and asked, hey, Dr. Fulani, my friend, can you please just keep this phone for me until I get 3,000 to come and get money for H. pylori? Yes.
Wow, that's really heartfelt. I'd like to hear maybe Steve, what would you add on to that? On to just comment about, they are speaking of there's a disparity between what goes on, what is planned and what's actually done. Is it that what's planned doesn't get done, or what's being done is being done to the wrong people? Please.
Legislation is there, and legislation is paper. It's a process that culminates into a paper. So translating that paper into action is the biggest challenge. So the paper is not faulted, but the people who have the responsibility of implementing the principles of the paper are the problem. And just to borrow from what she said, it is not by default that doctors are not paid. It is not. And it's just a fact. And I like using a practical example. Why does the army not strike? is because it's socialized in a way that it's known as a priority. Doctors are also a priority in terms of defense, but the socialization is such a way that doctors are so much middle class that they want to do their own strikes alone and leave the activists who are actually low class. So at the end of the day, you'll want your cause to be advanced by Bonnie. What about a Steve who comes from Kisumu? Steve is a nobody at that space. You see? But then when I'm coming to the facility, I'm coming to the facility on the basis that I know that you're supposed to implement what you've stated in your how do you call it? In your boards. If you go there, malaria test is supposed to be 15 minutes. I never see cost implications to that. But then when I get to the reception, I see cost implications. You see? That you need to buy a book at what, and you see there, you see? And in terms of, just to get back to the question, in terms of what is on paper and implementation, I stated clearly that when I was making the introductory bit, that we need to understand that the common mwananchi does not really, to an extent, do not know the legislation. To them, they see access as a priority, and they don't also see it as a favor. So when somebody comes to the facility, you're somebody who knows what is on paper, you're supposed to also help that kind of person who's coming to access services from you to understand what is on paper, so that this person can also play a role in ensuring that implementation takes place. So that's why, by and large, we see we're having good legislations, but they're not implemented. We're trying to play our role as civil society, just to try and raise awareness. But are doctors raising awareness? No, doctors are boxed in a chamber and calling next. You see, doctors are boxed in a chamber in a certain way that if then I even come and ask you, okay, what is your struggle? You'll be a bit shy because I'm not a medic. Why do I want to know your struggle? You see, in such a way that, and just to come to what she also said, trying to stating that doctors are also, no, you're the one who said that doctors are not martyrs. Everybody's a martyr for this country. Everybody has to play a martyr role for this country. Yes, we can't say that the political class are the ones who are martyrs in terms of allocating resources. No, to implement those policies. No, we are lying. We are cheating ourselves if you're saying that. Everybody has a responsibility to make sure that investments in health is actualized at the grassroots. And you have to be very deliberate about grassroots. Because when it comes to these panels, we are being watched live by people all over the country. And we can't only make, we can't put a caveat to this discussion to national policies. We also have county policies, which are not also responsive to healthcare needs. Yes, and people play deliberate and aggressive role in ensuring that those policies are in place. But then in terms of implementation, where? Yeah, we have KMPDU or whatever, yeah, which have even county chapters. What we see from doctors is a notice of strike. We don't see a notice of let's say, for example, a notice of calling people to action. You see, we see a notice of from Monday at Uko. Yeah, and then by that Monday, maybe a woman somewhere is supposed to give birth. Amekuja clinic, umefunga. What happens? Because you're not martyrs, you won't give a service. And you see them die. There's a practical case study of a lady who died here in Nairobi. Yeah, we know that. There's a practical case studies in Kisumu of women who die, of people who have had accidents and died, and deliberately they can't get service because doctors are not martyrs. Doctors have not been paid for 6 months. Can't we have a soul? Are we that much of a stone? You know, we need to ask ourselves these difficult questions. And then based on that is now when we get into the conversation of then how then do we make our government responsible? Because I can't keep on fighting for you if I'm seeing you allowing my child die. You know, I can't keep on speaking on behalf of somebody who's denied me a service. Yes, I go to the facility and I'm denied a service, and the next day there's a strike notice. I'm supposed to talk for you. No, I won't do that. I'll go back to hustle for my 100 bob that I always hustle for every day. Yes.
They shouldn't even tell us why they go have other, to sell the same medicines that are taken into the hospitals.
Yes.
It's an interesting discourse, actually.
So, just maybe to wind up, and just to pick a leaf on what you've said. We've had this conversation even with medics in Kisumu, because we are largely in the healthcare space as well. And the challenge has always been the referrals for medication. And you get to facility, then you get to, and we know KEMSA, they do supply medicine based on the request of the facilities. So we also know KEMSA has also COVID has also exposed them as diabad, in terms of corruption. So Mimi, I'm not a medic. I don't do procurement for medicine at the facility. So perhaps you can tell us, do you do those procurements? Do those drugs come? And if they come, why can't you access them? And why will you do, for me, a prescription of paracetamol to get to the next across the road pharmacy? Thank you very much.
Dr. Please allow me to respond briefly, please.
Okay, please do.
You know, we want
Briefly.
to talk about doctors like people who are not part of our society.
Thank you.
You know, what does it take to educate a doctor? Uko hivyo tu bundus, like your kid has done well, has really, you know, you call harambes, you sell cows, you sell land to educate your kid. You know, it is a whole village coming together to actually educate a child. Why? And I tell you this because it is something I've even heard from my parents, that they take me to school and they invest in so much on a bila kitu because I will be the light of that house. You understand? And that is a script. It does not matter whether it's a lawyer, it's a doctor, it is what our parents are doing for us. They're giving their every cent, their every breath, their everything to educate us so that we can be the light to that house. And then you have spent over $1 million plus, you stay 5 months without without pay. People had expectations from you. Umekuwa daktari, you know, people had expectations from you that you would be the light of that house, of that village. But now vitu zimekuja zikakuwa tofauti sana kwa ground. And we want to blame doctors, really? And that is what I'm talking about. This horizontal violence is not going to take us anywhere, because the moment they're on that side and we're on this, these are our children, these are our brothers. Why are we not understanding what they're actually going through? And when we talk about martyrdom, let me tell you, the reason why Jesus was comfortable dying, no disrespect to Christians, is because he knew that is how everyone else will get life. It was not in vain. You do not want to die for things that are in vain. Right now, so many people are not patriots because what are you dying for? This is a messed up country. What are you dying for? Your death does not assure a good life for your child. You understand? Dr. Mogusu just died. He was 28 years old. A wife and a child have been left. For what? For what? It is after he died that they're saying, but they were going to sort his bill. He was there. You understand? So this pain that we have as Wananchi is the same pain that the doctors are having, the nurses are having, the teachers are having. They're dying left, right, and center. And nobody's talking about that. Why? Because it's been muzzled. So even as we're talking about martyrdom, even as we're talking about this hypocritical oath, we also need to understand that, hey, by the way, unajua ni aje? Article 1 of the Constitution talks about sovereignty for all the citizens. It does not mean the doctors are different on another side.
Just to point out something, Steve, you talked about just to bring home what you're saying. You're saying there are silos that exist. You're saying people are, medics, doctors are on one side, activists are on another side. And I'd like to ask, now that we've talked extensively about what we think about right to health, what are the challenges? One of the challenges you've spoken about is, silos, a disjoint from, a disconnection from the grassroots level. What other challenges are there? And have these challenges been worsened by COVID-19? Yeah, please, Betty, if you could.
All right. on the basic human rights principles, which is access, that is in terms of governance. There is a systematic issue. That is one of them. That is a challenge. It's a challenge because during COVID-19, we observed that even getting PPEs, I can call them PPEs or mask or whatever. Hizi vitu tunazitaje kwa ground Njoki? Hizi za watu kuji masks, masks and sanitizers. Even getting masks and sanitizer that was supposed to have been procured by the government, then through KEMSA, and then through the national government received by Mutahi Kagwe, alafu ingie, to devolve government to our hospitals. Getting that itself was an issue for community health volunteers, during COVID-19. Why? Because the systemic issue again, the middle class, top facilities, ICU bed, but before mtu kwa grau amepatikana pale hivyo akona COVID-19 afikishwe kule, even getting an ambulance is an issue. Why? Because of policy and governance. Devolution should be taking care of the people in our counties. When you talk about health, we cannot talk about education. So if the health sector is crippled, then the people in the society are crippled. COVID-19 came itself with a whole economic stagnation where our economics was standing at 4 point something. That is to say that as the people try to recover, there is an issue about our unity as a people at a society level to take care of each other. For me to give, there's a place we went to kupatiana chakula and sanitizers. And a whole DCC, District County Commissioner, is it District County Commissioner? Our sub-county tells you, Waithera, on this day that you bring food for these people that are old and diabetic that need food during this COVID-19, you'll have to bring to us sanitizer and gloves, masks and hizo vitu zingine. It was the very first days after COVID was announced in Kenya and the lockdown and curfew measures were put in place. So if that is not getting to a policeman, then the issue of governance, the people of lack of people with goodwill, even if a governance is there, which is now usawa and all those things, we have failed as a country to curate what is best for its people. We have misplaced priorities. I was trying to look at how much a Cuban doctor is getting paid today. I don't know, maybe you can tell us because you're a doctor. But I would like to say that Kenya has misplaced priorities and Kenyans are living in silos because of the classist issue. And definitely if doctors were to view themselves as same as teachers, same as service providers, same as farmers who are farming out there if kama sikunywi dawa, nafaa kutumia mboga mzuri. If doctors were to look as themselves as first humanists before professionals, then I think we will be having a different debate. I think we'll have a unified front where we address the devolution, corruption, and all those issues there. But personally, if I found a doctor unwell, the first question is humanity. That's why we're here speaking about the discrepancies and the failure of the government and all these other issues, things from an emotive point of view, because we have lost a very young person in an economy that does not support otherwise 27-year-olds who are unemployed. So the bigger issue in Kenya is about corruption, graft, and lack of goodwill from its politicians. And of course, the people access, they know it's by right, but we have papers and then we have a fashion of the way we do things. Yeah.
Derito, please tell us something. What's your take?
Two things. The issue of access to healthcare is largely a governance issue, a poor governance issue that is coming out clearly. The fact that we are unable to organize in such a manner that everyone feels like they are part and parcel of this country, irrespective of their financial or cultural background. On the issue of doctors and us having silos and looking at it from a point of us versus them, which is very wrong, by the way. We shouldn't be at that situation. But what horrifies me is that, and the issue why even in public hospital, most of us have lost confidence in public hospital. We don't go to public hospitals. When you get sick, your first instinct is to rush to the nearest private hospital, or even the farthest private hospital, because you cannot trust the nearest public hospital. Inevitably is that the doctor who will treat you badly in a public hospital, and you'll feel like you don't want to go back there again. The same doctor you'll find in a private hospital, and they'll be very nice. They will ask you nice questions. They will treat you with decorum. They will appreciate you. Same doctors. I mean, the population of doctors in this country is not enough to fit the number of private and public hospitals we have. They do what? What do we call it? Yes, locum. I don't know, what do lecturers do when we're moving from one campus to the other? What's that one? Yes, it's the same thing, but it's the same doctor. So I don't understand why they have to treat me differently because I'm coming to a public hospital where I'll most probably not pay. But when I find them in their private clinic, the story is different, you know? So that also, in as much as they are our brothers, they are our sisters, we need to humanist first, irrespective of whether I'm working in my private hospital or whether I'm working for the government. Yeah.
So maybe just a question, for the available healthcare that's there, for the accessible healthcare that's there, is there an issue with its uptake? Are we looking at it from a provider perspective, also from a user perspective, the community perspective? How, because I think what we're trying to address, as you're saying, governance includes a lot of people, it's a multispectral issue. So tell me, even for the services available now, and also just to address the different issues like COVID-19 taking center stage and issues of HIV/AIDS being sidelined. I don't know if you watched on local news, there's a HIV upsurge in young girls now, in teenagers now. So COVID didn't come to replace other diseases, but I mean, it kind of may look to some people that it has. Maybe just comment on that, just to hear your thoughts in brief before we now go to.
Even as Mr. Okwani prepares to react to this question, we have been getting some feedback on social media. People are following us on hashtag Democracy and Rights Festival. And they are congratulating you for your thoughts, and they're saying that it's very emotive. And I would just like to read one or two comments. So Kwacha Africa says, right conversation being addressed at the right time to organize and demand for affordable quality healthcare. COVID pandemic has exposed gaps in our health and governance systems. And I think this is something that you all have agreed on. But there's one here that is very personal from Kasena Baya Timiko, who sent in their comment via Facebook. And she or he says, healthcare is a mess at this time of pandemic. My stepmother just died yesterday after being left alone in hospital without attendance. Young women are suffering in the village. No one is focusing on youth-friendly services. For real, it's a mess. And there's also someone who wanted you to address the issue of detention. I think we have also had cases where patients are detained in hospitals, whether that is an hospital administration issue or the doctors themselves. So even as you continue discussion, I'll be coming up so that we can engage with those following us online. So we are on hashtag Democracy and Rights Festival. You can send in your comments and I'll channel them through Dr. Ari.
Thank you. Thank you so much. I mean, first of all, we just agree that, condolences to that individual that has lost their loved one. That I don't understand the factors that surround that, but that should, it's a sad moment for them. So our sincere condolences. Maybe just to pick off from where we had left off.
Yeah, so I have a question. What is the ratio of doctors to patient currently in Kenya?
So currently, I had looked at that. It's about 1.5 to 10,000 now.
All right.
Dentists, I think, is about 0.2 to 10,000.
So that then makes medics be like the forefront human rights defenders. Mm-hmm. You see, let's just start the conversation from there, because doctors are the forefront of human rights defense in terms of healthcare service provision. And in terms of the challenge, now the responsiveness of the medics to offer services to the already existing services in the facility is one thing. And I give a practical example of the LGBT community. First, the COVID-19 pandemic has just made it worse because safe spaces have now turned to be unsafe again. So it's like the gains we've achieved so far we're taking like 2 steps back. So the medics have also just, because nobody knows when they're going to get COVID. So doctors are extremely cautious in terms of handling certain kind of diseases currently. Most of patients who are exactly that one, conditions like diabetes, like there's just an assumption that already, huyu maybe akonayo tayari. And McHugh, at that point, when I complain, government hajakupatia PPE. So the same, I'm not giving services because government hajanipatia PPE. Na kuna diabetes. Unaelewa? And further to that, the other challenge will be, we also having an issue with the consumers of these services. Because there's just a notion, we understand that there are some medics who are just so good. But there's just a notion behind a public health facility. Yes, and we've been trying to work around that notion that that the medics within public health facilities are socialized in a way that there are some services they won't give. Yeah, practically, and even right now, I know, even when nikuja kwako and just ask you, nimepanga line for like 40 minutes, nikuja kwako nikuulize, I just wanted to ask how to use a condom. The next minute, talk hapa. We have serious issues to handle. You see, we have to do rounds at the ward. Unakuja hapa kuniuliza how to use a condom. And I have a right to come and ask you. You see, that is my right. About the aspect of consumption of healthcare within public and private, the same medic who is in the public, who will deny me that service, will give me that service at the private facility because of my money. It's now, the humanity bit is now put aside. It's about money. Yeah, because now, just like Njiki was saying, we also have needs. You see? So we are putting our needs mbele kuliko our service. I want to give a practical case study. The reason why I started activism to just change the healthcare space. One night before COVID, we were walking at night with my brother, of course, and then we saw a gentleman next to a lady. So we thought that maybe this gentleman was raping this lady. So we went to help. Only to realize that this gentleman is the husband to this lady who apparently labor imemshika hapo. So this gentleman has never seen anybody giving birth. So ameshika the pipe, the umbilical cord. Ameshika hivi. Mtoto kichwa ishatoka. So I made a call to our nearest health facility because I work around within the healthcare space. They said they're going to get us an ambulance. 10 minutes later, an ambulance came. But when it took to Meka, they thought that maybe we are thugs. So he slowed down, karibu kufika, akaongeza speedy, akaenda. Few minutes later, a police vehicle, a Land Cruiser came. Karibu kutufikia ikaongeza speedy. Nikajua kweli kama polisi pia kumbe ni waoga pia. Wakaenda. So I said, the next available means is tuchukue mtu pikipiki atupeleke OC. Do you know, I could not even nimeshika damu. I could not even be given PEP. I couldn't. Because I'm being told, it's only 40 minutes. HIV is active within 40 minutes. Who said that? So, you know, I've been denied that service by that point, and I direly need that service. You see? So that is a bit of a challenge, even at uptake level. We have lived experiences that then make us also shy from accessing these services. Thank you.
Okay.
If I may.
Please do.
There was a time I was listening to Hot 96 and Seth Panyako was talking about the issues doctors were going through. It was immediately after Sabasaba, March for Our Lives demonstration. The COVID-19 demonstration that happened. And he was talking about the issue of procurement and how governance affects things at the devolution level, that we'll have public health facilities asking for all these things that they need, but we'll have the government procuring what they want. And the discussion about tetanus itself started, whether how easy it is to access tetanus, like it should be the most accessible kind of job you get from a hospital. And he went on and on and on, and he explained that graft at the top level again affects you doctors and your access to this service as a right. Graft in what sense? That people have been ordering what they want through KEMSA, and basically what the medicines Kenya needs down there in the hospitals is not what is getting ordered. So that is how bad probably our situation is, that there are people ordering things from the government side of things, not facilitating the hospitals the way they should. So that is something I wanted to point out.
Yes, and again, just to point out some, on social media, this issue of detention in hospitals and things like that. Sometimes I wish we do not shoot the messenger because you treat the patient, but you see, cost is not, it's not a doctor issue. It's an admin issue. It's not a service provider issue. It's now admin, because each facility has their own admin they need to run. So, and it's case by case. So I may not be able to give a blanket. No one can give just a blanket statement and say, this case, this happened. And again, there's other things that we need to know, more inside information on, okay, why is this occurring, and,
Can I comment on that?
and etc. Okay.
Okay, as an activist,
then we can give it to Njoki.
Sure. As an activist, I had an opportunity to work some time back in Parliament, and I was working for a constituency office, and every other single morning, that is in 2018, there was someone walking in asking for a letter from the MP's office to be written for them to go to Kenyatta and have their bodies released. Then upon following about 7 cases of people that came, so that I can do the letter for them, it was an issue about someone got access to healthcare, but they were very poor. They were not able to pay, and it becomes an issue about your MP writing that letter could really help much by, you're not gonna pay. The social workers desk is gonna take care of that. So that is other diseases. How about COVID? And I will say that the Kenyan law does not provide on the issue of detention. When patients are detained. If anything, that was among the things that when I was tasked to do policies, because I was working for an MP, to do a constitution amendment thing that would amend a clause that retaining of bodies in hospitals is inhumane, and it's not the right thing to do. Otherwise, what else am I gonna sell? Kama maskini yako pale hivyo chini. And this is Kenyatta, na nimepitia mbali nikakuwa referred nikapelekwa hapo. So the issue of detaining patients, as much as activists have tried to deal with it, because I tried to deal with it at that level, where you take a law, inaenda inapelekwa pale hivyo kama draft, yeah? It's being presented by this person. Is it a finance bill? The issue of policy and how things work administratively is another whole issue that is about human resource and not just about doctors. So Daktari is bound to a law because she also takes an oath of office, yeah, to serve. When they see who mna serve kwa hizo nini wanga ma take his oath. So these people, there's one issue to be a doctor, one issue to be a humanist, and the other issue to also know other things that happen within the administrative, whatever issues that happen. And that again is another systemic issue that goes back to the laws of a country. Yeah.
And I'm glad you've addressed that, because it's a systemic issue. It's not just one person or one thing or a set people. And like Njoki keeps on saying, we're keeping this conversation here. Well, this conversation, this is it's like a problem tree. When you look at the root of a tree, when you look at the trunk, so what we're trying to do is analyze the fruit. It's best we go down to the problem to analyze where does this come from. Njoki, please.
Okay. Now that we're speaking about challenges, I think I keep saying this country is a big joke. One of the challenges is that we don't have enough doctors in this country. And now the person who's actually even in charge of Ministry of Health is a PR practitioner. That is happened to tumefika kama country, like with such a joke like that. The other day,
he says in Parliament when he's asked about COVID money is that he only deals with the political responsibility.
Yes. So the other day he announces that we're getting more doctors from Cuba, and I am thinking, wow. Anyway, from a person who doesn't even know how a vaccine works, I was not shocked. But you understand that if you've got poor leadership, then nothing else is going to work. Nothing else is going to work. How many doctors do we have here who are going for months without pay, unemployed? They have to do, you know how they do locums, like doctors are always working. They have this job of sijui nilitumwa Murang'a, so you keep booking patients for me this whole week, and nakuja one day in Murang'a. Then this whole other week, all these other days, I'm in Nairobi hustling, doing locums in all these institutions. And you see, again, when we talk about challenges, we've always talked about brain drain when you're talking about professionals being taken from here to other countries. But right now, I mean, with this capitalistic kind of setting that we have, it's a brain drain from the public, from the public to the private sector. Why? Because the public sector is doing very badly. And it is the people who are in government who are in the private sector. So all that money that's supposed to be funding the public is actually going into the private sector. And so there's a brain drain nobody wants to work for the government. Nobody wants to work for the public good. Everybody wants to work for money. And I mean, that is where we will all go if there is money. So even as we're trying to see what is happening in our hospitals, if we do not understand that it is a political issue. Yesterday I was watching an interview, and I was the CEO of KNH, Evanson Kamuri, asking Kenyans and doctors not to emotionalize the death of colleagues. As in, wow. What? We've become robots now. We want to politicize every single issue, even when it is about the lives of citizens. We want to make everything so technical, even when it is about the lives of citizens. And this is why we are losing it. This is why, as you're politicizing all these things and saying, ngojeni kidogo kwanza BBI ipite, ndio tukuje tuangalie nyinyi madaktari, people are dying. Because it is political leadership, it is a governance issue, and it is that disconnect of the people that you put up there to run matters about healthcare. If this is a person who has no idea how healthcare is run or what the needs are, why the hell do you think they will take care of your needs? Why? They will not.
I also think there is a pre-existing myth between the understanding of public health facilities, what they are for nowadays, and what private health facilities are for. Private health facilities are for the rich that can afford special care for special kind of conditions. And then public health facilities are for maternal health access, kwenda kuzaa kama huna pesa, or, which is the other one? Picking medicines. Yes, that is how, like she mentions it, public-private partnerships have continued to put Kenyans' lives on the line because it's about the hospitals and how much they can gain.
Maybe just to redirect or just to look at this, because I think looking at, so a personal thing, because I know most of you work with the grassroots, at the grassroots level. This talk on, let's say, COVID-19 measures, wear a mask, wash your hands, use sanitizers, observe social distancing. We can look at a way to blame the health infrastructure, but we also look at how people live. For example, in Kibera, when you tell people social distance, so we live next to each other, in a way that first of all, they were not socially distanced even before COVID. So, just looking at it I think it's a multispectral issue, just like I keep on saying. However, how do you think, as now people who work with the grassroots, how can you increase your efforts to advocate for change? How can you be that beacon of hope to the communities that you represent?
You mentioned the issue of, especially in slum areas and communities, that people are being able to adhere to, the simple protocols of prevention of COVID. Being a public health issue, one of the most important things in public health is prevention. We talk about curative, most of us here are talking about curative diagnostic things, but the core of community health at the grassroots is preventive. And we live in communities whereby the basic thing, like availability of clean water in the home, is an issue. So you tell someone, wash your hands, wear a mask. Wash your hands where? A jerrycan, a 20-liter jerrycan of water will cost them 50 shillings, 20 shillings on the lower side. For a person who earns less than $2 a day, it's practically not possible. And some of these things, in as much as you're a community health worker, you're down there telling people, this thing is real, this thing will kill you, this thing will affect your family. How practical was it to tell them to wash your hands every time? Don't shake hands, you know. Don't stay 1 meter away from each other. The practicability of it was simply not there. The solution would have been way beforehand, and though it was not possible, it's a global pandemic. It's been to make sure as much as possible that we don't get as affected as maybe the rest of the world was. But that was not possible. In a third world country, in a country where people have to go out every day and earn a living for them to put a meal on the table, and then you're telling them stay at home. Yeah, it was just practically not possible. And that was a big challenge. And moving forward, we need to make sure that we're looking at some of these amenities, which basically it's an economic thing and a priority thing. Access to water, proper housing, sanitation, a toilet, yeah? The things that would go a long way into making sure that when we talk about the costs of healthcare, we're not talking about you having been diagnosed with cancer or with H. pylori, and now we're trying to treat you. We're talking about how do you not get H. pylori? How do you not get typhoid? That is what is important.
And just to build up on what he's saying, so when you say when you tell someone wash your hands with what water, where are they getting the water from? The COVID-19 preventative measures, do you feel they are classist, so to speak, or do they address? Did they take into consideration every socioeconomic class that lives in Kenya, or that was for a specific class of people?
It might not have been classist. It's basic common sense, basically. You need to wash your hands for you to be able to, whether you are from what class. But then, even it being common sense, the availability of it then makes it classist, make it out of reach for the majority of the people, in as much as it's the most simple and common sense thing to do.
Yeah, so in terms of the measures, I'll say, and of course the role that we've done so far, it's our role has largely been advocacy and of course awareness creation. And there's a next thing to which awareness creation also ends. And she said where then money is involved. Because if you look at the MOH protocols largely, it's about putting on masks, social distancing. Practically, Obunga or Nyalenda in Kisumu, you tell somebody to wear a mask. Somebody cannot afford a surgical mask. So what do they go for? Zilla masks are 5 bob, which do not even filter hair at the end of the day. So they are just putting on the masks because of the shikwa. But then they're not preventing themselves from COVID. Are you getting that? Yes. Another case scenario is, and we saw that on social media a lot in Turkana, where people are getting water, in jerrycans. Make a jerrycan, margin brown. So that margin is even exposing this person to even much more harm. You see? But because lazima aoshe mikono, itabidi ameosha nayo maji chafu. You understand? Akitoka hapa anaenda kukula, so it's COVID plus even diarrhea. You see? Yeah. Then later on, okay, we are attempting to laugh on this, but serious. Then later on, we are having sanitizers. These sanitizers are also very hazardous because you get to this facility, use a sanitizer with a different like chemical composition. You go to the next building, it's a sanitizer. People don't know why their hands are becoming white nowadays. People are using petroleum jelly, but mkono ni kama ni ya jembe. Because the sanitizers zinakulima mikono deliberately. Unachukua hii chemical, unaongeza na ile chemical and another chemical. So you're even exposing yourself to much more harm than even preventing yourself from COVID. You see? Social distancing. manze tusidanganyane, it's very difficult for a low income person because lazima ende jua kali. Jua kali pale ni kama watu wanachimba mtaro. Mtaro ni watu 50 hapo ndani. Yeah, utaambia wasati sasa leo tutatumia watu 3 ndio wachimbe mtaro. So for social distance, it won't happen. These other 47 people are going to wait for the 3 people to kuwanyang'anya pesa wamewakia the whole day. So in a sense, the MOH protocol are just telling us that we should thrive in crime rather than defend ourselves. It's a personal responsibility, yes. Government imetuacha. Take care of yourself. People are trying to take care of themselves. Yeah, but in terms of socialization, these MOH protocols are a bit friendlier to the middle class and high income status, because somebody will come in here, and we even see the politicians, they go to rallies with even masks that have air filters mounted on them. You see, for them they're preventing COVID. What about you as a person? You're exposing yourself even more. Thank you.
And just in brief, Njoki, you can comment, and then we'll go to the audience and also engage social media, see what people are saying. Karibu, Njoki.
I want to actually agree with you and say they were very classist, the measurements. In Githurai, if we have the motorbikes that are in Githurai right now, not less than 50,000. You know, I am always in the morning hours, in the rush hour, right about Githurai. You'll have over 10,000 motorbikes. You'll have the train. You'll have the tuk-tuks. You have the people who are walking. Mpaka kuna jamii wase, like mnatembea, but tunahave kusimama kwanza wase wapite. You understand? And so, and there's the market. So at one particular moment, minute tu moja, that Githurai roundabout has around 100,000 people doing different things. And they're there not because it's a hobby. They're there for livelihoods. So, and it's a very small space, by the way. So how again do you tell that person to social distance? You know, I look at Mutahi Kagwe, akipasha wase, atanape wase lectures how irresponsible we are. And I'm like, dude, do you know the kind of life that we live? Like, at some point, actually people in the ghettos are wearing masks for police. Not because it's COVID. Ni juu utaki kutoa tango kwa makarao, you know, and you have it here, you see a Land Cruiser passing you, and then after it has passed you, you put it down, you know, because it is an impossibility. Article 43 actually speaks about social security. The amount we're talking about in COVID-19 billionaires is 43 billion plus. Ata mgepatia wa Kenya 10K tu, kapatu 10, you know, you will take care of 50 million Kenyans. It's not that we're talking of impossibilities. This government can actually take care of its citizens, all of us. But no, it's busy stealing all this money for themselves. You know, they come to presses and say we have released 10 billion. To who? To who? You just where you are, you have around 20 households. Nyinyi mnajua nyinyi vulnerable ikiandikwa mnakwanga na capital V. Unapata? And you're being told this money has been given to the vulnerable. Who are the vulnerable if not this person? As I was saying, okay, me hata nimeomoka kidogo napatanga so 2 per day. Mother ni as in akona watoika 15 kwa hao anaendanga kufua vibaru chukusaya kuna there's no you know, people are not giving these jobs and she's not on the list. There's a widow there, they're not on the list. There is a Kamzae there, they're not on the list. So you're wondering, okay, this 10 billion, the vulnerable people, who are these people? But are we asking those questions as Kenyans? We are just taking everything they're telling us at, no, we've given 10 billion. Who was given this 10 billion? You understand? So those measures that they put, Kenya said hakuna maji. No, there's a lot of water that can be supplied to the whole country by cartels. Wakiwa wapi? Even just this COVID-19, they would have decided to open and block the pipes, but no. Why would they do that? It would be impossible to go back post-COVID. You know? So you will find them branding Bowsers. It became a campaign. They branded everything pakaunga. You know, so that even as you eat your kaugali, you remember this Messiah is the one who came through 2022 nitarudisha mkono. You know, so when they're saying stay at home, it is either COVID kills you or starvation kills you. So who are those measures for? When they say wash your hands, with what water? Maybe tutapika ama tutosha mkono. You know, and this, it comes out as a laughing matter, but this is the reality on the ground. It's not a joke, you know, because this COVID-19 came to expose the gaps of the rich and the poor, and the richer got richer and the poor we're still getting poorer.
All right. Thank you for those comments. At this point, though, I would like us maybe to engage the audience, you know, if we have any questions, you know, hear from Bwana MC about social media. And also just to maybe two things that should linger in your mind, because we're going to have, you know, audience engagement, and then we're going to give our final remarks. I'd like you to think about future opportunities. We've addressed a lot of issues that are going on, but I would like this talk that we've been given, this opportunity we've been given, to be the nexus of solution. You know, to give some actionable steps. You know, let's think. What are you going to do when you go back to the community you represent? Which message are you taking them? And also just when we look at the inequalities, what's the tipping point for us? Have we reached that tipping point? Are Kenyans angry enough? You know, ni wapi tutachora mpaka? Yeah.
Yes, and as a matter of fact, you've just ended on a comment that ties in beautifully to a comment that was made by one Nicholas Songora. He says, this session is very emotional. The question is, when will we get angry enough and have the change we want to see? Are we organizing or still have room for agonizing? And I think it almost, and then we have a gentleman here who has a question, and he will ask it now.
Thank you. My name is KG's Heavyweight. So I'm a rapper, poet, musician, and all that. So kidogo manze, tupelekane na rieng hapa hivi venye iko. Tupelekane tu na rada. There's too much French and English going around, forth, back, and center, you understand? But I'm just from the ghetto anyway. So I'm gonna take it a little bit slow. Kidogo, I understand in life there are natural degrees, which you don't have to go to the university anyway to get them. Because the same people with the first honors degrees in this country, the Seth Panyakos, the Mutahis, why do we pretend a lot like our systems are very corrupt? And I'm just saying this on a point blank note. Kama Mutahi afanyi kazi yake, afukuzwe. In the rural centers, women and young ladies have to walk kilometers 70 to 100 just for post and pre-maternal, either way. So ghetto huko hivyo, boy akikaa, hawezi ogopa corona. Uko base, you just do like your ganja 2 or 3. Corona hata ikiona inataka kuingia kwa mse ama malaria inajipa shughuli, haiwezi ingia hapo hivyo, unaona. I happen to be at a sitting board member about this year with nominated Senator Sylvia Kasanga from Wiper Democratic Movement. So we were championing for the mental health amendment bill in this country. Luckily, attracting close to 1,000 participants in the country. So when we inquired about the MH Bill 2019, the same thing. So I don't know if it's the wiper watermelon effect or something, nikaanza kupelekwa tu hivi. So naambia, we kama msanii, wewe utengeneze kitu poa ya kurap about mental health, manze hiyo ni art therapy, alafu itawabamba. I'm like, what's wrong with these people? So if it's social amenities, it has to be advocated for, championed for strongly. Chapter 13 and chapter 12, public services, public finance. Chapter 6, leadership and integrity. Chapter 1, sovereignty of the people and supremacy of the constitution. So hapa hivi tupelekaneni na Riang jo venye inafaa. Hii kizungu mingi mnatuchanganya au sio? Cheza na rada hapo. Thank you.
Lakini hiyo kizungu ni kama alielewa pia, sio? Otherwise he wouldn't comment. So we'll go to the lady here and then
Hi everyone. So some of us who are from coast, we are floating from what you're saying. We don't understand. Imagine ilikuwa na nafikiri I was thinking maybe alikuwa anafanya poem ama ana poet. Anyway, on a lighter note. So I come from coast, and first of all I want to congratulate the panel who is there, especially to the ladies. I'm so touched to the words that you're telling us. And it's so unfortunate that the experiences that you guys are facing are more or less similar to what you're facing at the coast. But the problem is here at the coast, people are not aggressive as the way they are here in Nairobi and other parts of the country. Sisi watu wa pwani, kuna hiyo taswira ya kuwa tumezoea kukaa na kungojea maembe yaangushwe. And I can tell you for a fact that those things have changed right now. But there are those myths and culture that are still bounding us. For example, when you talk of healthcare, it's so hard for a mama in Kilifi County who is almost delivering to be taken to a hospital to go and deliver. One, they will say, tuko na wakunga, the midwives. We can deliver at home. Second thing, the first thing they fear is the stigmatization of COVID-19. They say, the minute I go there, I'm going to be kept in an isolation. And that isolation, it means that my kids are going to be left behind without food or anything. So they rather stay at home, and we've lost so many lives due to that. Again, when we have people with simple illness like fever and everything, you tell them, let's go to the hospital. They say, nani? Mimi? Nikifika huko niambiwe niko na corona alafu. So then they stay at home until things get worse. Why am I saying this? It's because of the way people are being handled. The way patients are being handled, the way the community are being handled. Right now, we even had to facilitate some people to just go to the hospital to get their health rights in order for them to be treated and come back home for fear of stigmatization. Again, when we talk of the medics, I concur with my brother who says they are human rights defenders. They are also activists. So when we talk of activism and they're there saving people's life, they should be at the forefront in this debate. When we hear a doctor has died and their rights were infringed, they should be the first people to organize, not the activists on the ground. You know, some of us, we can come and support, but you should take the forefront, and that is something that they need to understand. Whenever you call for a demonstration, it's so bitter and so painful to see only activists on the ground. Who are we fighting for? Whoever we are fighting for are same people like we are. It's not that we are living in our own world ambayo tunafaa fight for other people's right. People should own up these processes, then they will have change. If we see Mutahi Kagwe is not functioning well the way we want, who are we to say that let's go out and demonstrate? There are people out there, even the same politicians, they can say, ebu tuiteni watu tutokeni kwa barabara, but people are waiting for Kina Boni and the likes of Njoki and the same. So this is not right. So what we need to do is, yes, we need to get more bitter. We need to sensitize our community, and we also need to enlighten our people of their rights. They need to know if they don't have water, who are they to go and line up during their elections and, you know, give votes to these same people who don't solve their problems. When you talk of ghettos, why should we have ghettos in the first place in Kenya? You know, we shouldn't have them. If we have people who can live in areas ambazo they are very poshy, we should work on getting them out of those places. They are eating our money to live in those poshy areas, but then we allow them. We go and knock on their doors and beg to get only 100 or 200 shillings. Why should we do that? We need to starve for months for us to get the change we want. So we need to do more sensitization. We need to get more people to be activists, and activism is not something that, you know, it's coming from a bloom. It's everyone. Kila mtu akona activism in them. They only need to understand what it means when you are called an activist. So that is something that we need to advocate for.
Thank you so much for that brilliant comment. I had seen a hand here earlier from Luo Boy. Let me go to him, and then maybe we can take 2 more.
Yeah, thank you very much. I always have something to say. Kwanza hapa kwa health manze. My first question goes to Stephen. Stephen, there was a report in Kisumu, I think it was 2 to 3 months back, that there were no even doctors in the villages in Kisumu, and it was so sad that the schools were feeding the patients in the hospitals, in that there were no even food in the hospitals. People were lying down, people were dying, and the same people that we sent to the county offices were the one who were conducting these reports, and they came up with these reports, and they even said that there are some hospitals that had even they didn't have even doctors. They had nurses or clinical officers doing the work. And recently, one of the doctors who we always went to, he died. I think he's been treating a lot of people, and he lost his life because of COVID. I think it was COVID-19. So, as a human rights defender and as defenders of the people, what are you guys doing to make sure that these hospitals, the government or the county government, does or goes to an extreme of even providing beds and providing food to these people in these hospitals? Again, I have this concern. Something is wrong with this country, and it is not only the doctors, it is not only the politicians, it is us, as the people, as the public, you know, as the people in the ghetto. Because we can talk here, we can tell them that man niaje ule mse mwenye ulieka ndio anazuia hii stuff kufanyika kwa hii country. The same guy ambao unamwambia ati hiyo ugonjwa yako manze, enda kwa hiyo hospitali ukatibiwe, alafu anakosa kutibiwa, na kwa sababu alipeleka ule mse mbaya, anakuja anarudisha tena ule mse mbaya. Unaona? So like a singer, one of the artists said here, we have to change our mentality. Now I believe that doctors ndio wako na hiyo that professionalism ya kuleta therapy kwa brains wase, kwa sababu nyinyi ndio I guess mnadiligi na wase mob. Unaweza kuja unawaambia msee mazeni aje, mnakufa kwa sababu ya msee, mnakufa kwa sababu ya CS. Alafu another thing, kama doctors manze, mnaekewa msee wa PR bana akuwe CS wa ministry bana, alafu nyinyi mko tu contented pale manze, mmekaa tu bana, it doesn't make sense. Kama umewekewa msee mwenye ajui hata dawa ya malaria ni nini, ama ajui jab jab yote inapewa aje, so msee ndio unamweka hapo hivyo ati anakuwa CS, na nyinyi bado mnaendelea na kazi. Si mpetition mwambie huyu msee mazaa tumtaki pale, ajui interest zetu, ajui interest za public, ili at least tukuwe na a better healthcare than ile kitu ambao tuko nayo sahi. I saw here in Nairobi that manze, a woman is giving birth mbele ya gate bana, alafu kesho yake ma politicians na ma women rep wanakuja pale wanapiga kelele, niaje, you should not do this to women, nini 1 day 2 days, alafu your story inazama. Manze, we should not normalize these things. Amefanya hivyo, si tumtoe pale, si hapo kwa constitution, si kuna petitions tena tunaweza right, tumwambie niaje, human lives matters, ni human lives kwanza, ndio tuone lives za watu wengine. Unaona? Another thing na ma doctors, like my sister amesema hapa hivi, you are the first activists and you are the people who, right now you are the people who are dying more. Unaona? Na nyinyi ndio inafaa mtusaidie. Unaona? Sasa nyinyi kama mnakufa, sasa sisi naye sisi pia tutakufa tu. Jua tujui ni nini na nini inafaa tufanye. Jua hata hiyo kuosha mkono, ndio hiyo tunaosha mkono. Lakini what next? Ndio hiyo tunaweka mask. Hii mask, manze mimi nimevaa mask nyingine manze for 3 days bana. Hadi nashangaa, ni aje hii mask nimevaa for 3 days. Wacha nigeuze. Unaona? So ni tricky sana manze. So inafaa kuna mse by the way, ni true kuna wase wenye hata hiyo mask yenye walikuwa wanavaa last week kama last month bado wanaivaa sahi. Na another thing kama human right activists inafaa tuambie mapolisi pia manze ni aje hii kitu inatushika si wote. Si ati tu ni public peke yake, si ati ni daktari peke yake. Hata mapolisi, hata mimi najua mapolisi wenye wamededi na hii COVID. Na unajua hao wasee wakea, hao wasee wanataka do, jua hao walipipoa. Jua pia wamepoliticize hiyo upolisi yao, hiyo polisi yao imekuwa politicized. So ni kitu yenye imetushika sisi wote. So it is upon us tuambia watu wa public manze, ni aje let us vote for the right leaders manze. Si ndio? Thanks sana bana.
Asante sana kwa maoni hiyo mzuri sana. I think I'll come. Well, we can have Mr. Songora here say a comment. Let me just sanitize the mic for you. And there was a comment on social media that are we poor or is healthcare service provision poor? And it goes back to the question of classism that we discussed earlier. Mr. Songora.
Thank you. Salamu alaikum. Leo nitaboronga lugha. Nitachanganya for the benefit of everyone. First, I'd like to appreciate the panel. My name is Nicholas Songora, the Civil Society Coordinator in Coast Region and Director Manyata Entertainment CBO. Mine is all the panelists this morning. My question is, how true is our advocacy on access to responsive service delivery? How true? The reason I say this is, how is this advocacy seeking to normal mwananchi? Mwananchi that is at the village level. Mwananchi ambaye anatembea mguu kwenda kwa dispensary. Mwananchi ambaye anakuwa forced to leave the public facility to go to private facility only to meet the same doctor. And tomorrow, the same doctor comes in public domain, say you want to strike because of ABCD. Kwa nini wananchi wasikae pembeni waseme sasa hii maneno ya madaktari? Sijuzi nilienda nikakosa dawa, wakanifukuza. Mtu wangu akauawa. Na sasa hivi wao wanasema kwamba hawajalipo miezi 6. Situachie ni ngori yao. The question is, how can we look for a common ground so that this plight, mwananchi ajue kwamba as much as the doctor is complaining, this thing is also affecting me. How can we have an advocacy that involves the Wanjiku, the doctors, and the grassroots leaders? If you're able to find that common ground, then eventually the leaders, the thieves, watasalimu amri. 2, my second concern is COVID. The moment our doctors and nurses in facilities decided to attend during the first wave of COVID-19, the moment they decided to attend to the few patients COVID positive without proper PPEs, I knew that tunaingia katika disaster. And this is the moment tulipatia nafasi wale wezi wa COVID funds wakaiba pesa kikamilifu. Because the point is here, through my own study, nimegundua kwamba our nurses and doctors wanaogopa sana kukosa kazi kuliko kufa. We started a campaign in Mombasa, and I will tell you, first time people were saying nurses want to strike. Tunajiprepare kama activists. We were doing we were preparing drafting a memorandum and also a press statement. Tuende kuingia Jumatatu tufanye press conference in support of our doctors and nurses. Only for us to receive a message after 2 hours that the doctors have called off the strike. Then you get confused. Tumecharge wananchi, tumeamshana, you have to do this together, we are in solidarity. When first we told doctors there is no consultation. Sika tumeelewana. Kuna gap hapo. And then tomorrow come again say want to strike. Now the activists say let us give them time tuone kama wata call off ama bado. And then the government sees you are not serious. And they know they have divided and now they are ruling. And that's why they can be very bold to tell us, madaktari simuvumilie jamani tumalizane BBI. This is a joke. It's a slap on the face. And I wish I was in that press conference wakati Raila alikuwa anaongea. Wangenifunga. I would have been behind bars because that is, I can say, it's so saddening. Next, we have cartels. Like any other story. Yesterday we were having a conversation of how activists can join forces to put social change. It's the same thing. Katika doctors union, nurses unions, pia kuna makatel. Kuna watu wako hapo for PR. They are there to serve politicians' interests. They are the ones used majorly to divide. And I think corruption pia inatembea huko. So I think for us to help this problem, because the person that is really suffering ni mwananchi pale mashinani, I think we start by wiping the house. Hizo unions, hizo networks za madaktari, are they genuine? Who is fooling who inside there? If you guys can come out and name and shame these people so that we know katika union ni mtu mmoja huyu na huyu na huyu ndio wako na shida. Hata kama nyamwezi ongea kwa sababu unaogopa kuwa fired, which is another problem. For me, I rather lose my job than endanger my life and the person surrounding me. That is the problem. If you're able to tell out to the government that I cannot go to this operation room if I don't have proper PPEs. Because today, I will tell you, this is a fact. Doctors, nurses, wamefanywa kuwa carriers of COVID-19, whether we like it or not. Because today I'm here attending to a positive case. Tomorrow I'm here dealing with a patient. It has become, imekuwa ni confusion of the highest order. So unless we are able to have a candid conversation, already here tutupiana maneno, madaktari wamerushwa huku, and this is what the leaders want to hear from us. They want to see us fighting each other, knowing that now, tukianza kushambulia daktari, mwananchi atasupport kama serikali. Tukianza kushambulia mwananchi, daktari atasupport kama serikali. That's why that information that came out, jamani tungojeni BBI ishe. We still have Kenyans who are on social media supporting the sentiments by Raila Amolo Odinga. It is saddening. Thank you.
Thank you so much. I think most of them are coming out as comments and really in agreement to the discussion we've been having. And Dr. Kamau was categorical earlier about not killing the messenger. I mean, we get the sense that the doctors are being thrown under the bus, but the problem is systemic. If, for example, I mean, we see problems with the teaching profession. We see problem even in engineering. You see this building collapsing. And so, I mean, we have a governance problem, systemic problem, but now it's coming up in different areas. And then if we are tackling a single area, it looks like, the dogs here are the villains. So we'll have one last brief ones, and then the panel maybe can respond to that and wind up as we close.
Mine is actually a comment, yeah? And I'm saddened by the fact that people know what to do or what they should do, but they're not doing, yeah? Like we are here saying we have a PR guy kwa Ministry ya Health. But then we as citizens empowered the guy who appointed the PR guy kwa hiyo ministry. Yeah? Tumeongelea hapa story ya unaenda kwa hospitali unakaa for hours. Are you sure the current president that you elected ako familia na kupanga laini? Ama akisikia shida anasema wacha tufungue mlango tuone vile shida inakaa. And you're the same people when you protect these people with all you have. I'm saying this because I wrote a piece. People have the we mentality. When you ask people, nini nafaa ifanyike, atakwambia, you know, people should do this and this and this, but hawa watu ni nani? We should stop the speech mentality. What are you doing as an individual, as a citizen? Wewe unafanya nini? Yeah? I wrote a piece, particular piece, directed to a particular person. Mtu ananiambia, you know, umeingilia mtu wetu sana. Some of the people at our civil society, you know, people who are fighting for rights. Penye tunafaa sisi kuchukua responsibility, that is where we draw the line. And it is very saddening. Tunaangalia tu our leaders, our politicians. Like, I assume that comment was about competence, yeah? The PR guy ndiye anasimamia the Ministry of Health. Just the other day, there was a conversation about MCAs having degrees. And we were celebrating, yeah, MCAs wanafaa kuwa na degrees. But sini you guys elected MCAs when you wana degrees. So we should stop the speech mentality and ask ourselves, what are we doing as an individual? Wewe unafanya nini? Thank you.
Thank you so much, Mr. Webber. I'll just read one comment here from those following us on hashtag democracy and rights festival. Rachel Mwikali says, it's our collective work as active citizens to hold government of Kenya accountable. The public should stop burdening activists unless they are to be paid by taxpayers' money. And I think there are two activists on this panel who will agree with that. But nevertheless, Daktari, we have about 10 minutes, so you can just take it there from there.
All right, thank you. Thank you. That's really engaging, and I know some of you want to respond, but we'll keep it just a bit brief because of the interest of time, and then we'll wrap up with our final words on what are the future opportunities from here. Kindly, Steve, you can go first, then Njoki, then Betty, then Mr. Nderito.
All right, so there's a question that was asked directly to me. So in terms of the number of people who died, it's about 4 months back, not actually 3 months, 4 months back, when we had our medics at the county level striking. So, and that's then brought the discussion of humanity as opposed to the money. So we did of course we did have conversations with the CHMT for the county, and the conversation was largely about how then can they be how then can they just go back and offer services even through the CDC program that was ongoing, and the statement was clean and clear that we've been given promotions in terms of job groups, but no salary increment. So the issue was not about commodity or service. It was about salary increment. They're already earning something, but now because of this increment, now they couldn't go, increment that is responsive to the job group. Now they couldn't go to work. And that was so inhuman. So we had to really have, have pro bono medics just going there to offer services to these persons. And of course, just what the guy said, we had locals really taking food to the facility. Literally, the local community taking food. So that also demonstrated the level of responsiveness of communities in terms of just ensuring that healthcare systems work. Yes, thank you. And there was a question around, no, I'll let another panelist answer
that. I think I want to talk to the fact that we Kenyans have a mentality of talking at each other instead of talking to each other. And I mean, these are divisionary tactics that politicians have really, put in our psyches as Kenyans, because you will want to hear, like he says, speech mentality about people knowing what they're supposed to do, but they're not doing it. But what we need to all understand is, I might know, I might have that clarity about what my area as Gedurai needs, but I have no idea what kind of urgency people in Nyalenda would need. So unless it is organic and it is from the people of Nyalenda, and it is not me coming with a know-it-all attitude and telling you this is what you need to do, like a prescription of, by the way, these are your issues and this is how you are. It is about us connecting struggles. It is about me in Githurai knowing what someone in Madare, someone in Kayole, someone in Korogosho is doing, and finding cross-cutting issues that we can all organize under. You understand? So it's not really about me being in this being in this room and asking other people, you, what are you doing? It is about, with what you're doing, how can I connect with what I'm doing in Githurai? You see, getting to a place where we are speaking to each other and not speaking at each other. And that is where the system is beating us at. Because, and you ask, you said, are we not angry enough? It is not about anger. Anger is one of the things. But if we're all angry, if we all now got to that tipping point and we were all angry, we would go to the streets and guess what? There'd be anarchy. Is that what we want? Really? Do we want anarchy? Do we want to kill each other until there's no Kenyan left? So unless we are organizing better in our communities and connecting our struggles, anger is going to be foolish. We're going to kill each other in the streets, you know? So can we all get to a place where we're talking to each other? Because you will fix healthcare today, but education is dying. You know, every other sector is dying. It's not about healthcare alone. So it's not about us saying, now we're fixing healthcare, then tomorrow we'll fix education. It's us coming to a place and saying, our country is failing. How do we salvage this country? So let's start speaking to each other and not at each other, because the only way we will get out of this mess is if we're all on the same side, and then it becomes very easy to just lock that box and throw away the keys of all those hyenas that are leading us right now.
Thank you. Betty.
Thank you. This discussion has been really formidable and fruitful. Let me say that. I don't want to answer any question in specific, but I picked points and I won't answer. I will leave them, us, with something to think about, and also summing up what Njoki has said. I'm a writer, so I also have a problem of being a poet. So we live in a Kenya where everyone is reading the Book of Lamentations and living it, and it's that simple. Owebaism. Oweba, how are you? I'm Moidera Wanjiru, convener Red Vest Movement. He did a piece, like he talked about it, about Ruto, about all those other things that we know that are happening in Kenya. But I'll say, again, we live in a Kenya where everyone is reading the Book of Lamentations and living it. We have gotten comfortable in social media talking. We know who the enemies are. We have seen that the doctor's issue is not an issue in isolation. Someone has asked about movement building, a question about movement building. And I would like to say that being an activist, you're not an expert of life or an expert of law. You're a self-sent soldier, a community leader, an opinion leader by the virtue of that first you're a leader. So I'd like to pose to us a question here. assuming you're in a place where it's one of those fine days you're in primary school and your teacher tells you, wake up, tokeni kwa class mwende muokota makaratasi uko nje. Where do you start? Do you start from the end of the field there, or do you start from where you are? You start from where you are. So as we feel inadequate, as we feel that all these things we are talking here are not kind of your type of thing, let me say that someone is here because they know something about policy. Someone is there because they know something about community organizing. Someone is there because they can tell the times that Africa is in terms of leadership and change and governance. Kenya is not having COVID in isolation. Tanzania is. Uganda iko. Lakini pia elections zinaendelea huko. I would like to say that we are on our own on matters COVID-19 as the people of Kenya. And now since we know who our enemy is, it's all upon us. It's not about asking anymore how angry we are. Because someone said, till the middle class is in the struggle, the revolution shall not happen. Until tuanza kuangalia hizi issues, si issue ya doki peke yake, si issue ya daktari, si issue ya mwalimu peke yake, until we all go hungry. The tipping point is here. You're asking when it's supposed to come. It's coming. Because no Kenyan will see a young doctor die, na anyamaze, si ndio? Yes, the ground on how we coalesce these efforts, these energies, this spirit of revolution and struggle, regardless of ideology, for as long as we know the enemy, we shouldn't be asking how nini we are, how angry we are, whether we are angry enough. That is a question Nerima Wako asked everyone in 2017, or I think 2016. Kenyan youth, you have a responsibility to go and take Mutahi Kagwe's job because he's a PR practitioner. Uko na hiyo responsibility ya kufanya hiyo kazi. Kenyan youth, you have a responsibility of taking Uhuru's job because by virtue of we gave him, or people gave him, people put him there as Kenyans, whether legitimately or illegitimately, and now Baba is with him there. Ni kazi yenyu, ni kazi yetu, but si yenyu at a personal level. So we say power to you. Power to you, regardless whether you are a unionist, you are a laborer, uko unafuata kotu ama ufuati nani, for as long as it's paining you, for as long as you can no longer go and afford hizo madawa, for as long as life is not stopping, for as long as you're eating. Doctors' issues are not issues in isolation, and the time to ask whether we're angry enough is over. I'm seeing the doctor situation bring into Kenya a Sudanese type of a situation. The same thing that Bobi Wine is doing in Uganda had to come from a very basic thing. Oppression. It's either you live or die in Uganda, Sindio. In Sudan, there was a time last year, it was either you lived or you died, Sindio. Right now, why is Sudan? Sudan is in a moment of anarchy. The people of Sudan have to prepare for themselves, have to prepare themselves to take leadership from the people, the Bashir, the military, all these people, about the processes, revolution iki happen. But where did it come from? A single issue about access to water, bread. So kama madaktari tunaumwa zaidi, I'm a doctor because I'm a comrade of theirs. Yeah, I'm a doctor, Sindio. Are you a doctor? So do you feel them? I'm a doctor because I'm a comrade of theirs. And if the person sitting next to you is a comrade of yours, if you're a humanist, time ya kuuliza whether we are angry enough iliisha. Wewe Kenya unajua na vile unajua kuorganize to bring people here. But then also ask again, are Kenyans ready to be led? Is it a leader we're looking for? Is it urgency we should be talking about on how fast we should move to end this problem already? All right? Or do we continue living? All right? Na tunakutana hapa kwa forum kwa makongamano ndio tunini. We talk about the issue of Kenyans. I think tumemaliza kuongea, we are tired. But we won't be tired until we've gone hungry. And we don't need science ziendelea kutuambia ati Uhuru akiendelea kuiba pesa na matimu zake za COVID-19 and all other budgetary allocations in this country, that soon enough we won't only be dealing with corpses because everyone else is COVID, either affected or infected, but soon enough we could be dealing with other issues. Hizo zitakuwa ni issues gani? Chakula. Kama chakula ndio inafanya mtu kwa grao ako nje saa hizi cause ya COVID, pia daktari ndio hakuje hapo kutafuta pesa, anaenda kuatendia nani ya COVID patient. But kwanza ameenda wapi? Kazi. The thing is humanism. Whether the struggle is right or not, let's stop bureaucratic let's stop making bureaucratic processes come up with a struggle. Let's stop isolating ourselves from the issues at hand. And the issues at hand is COVID-19 is here. The doctors are here. They're not being heard like teachers have been heard or they have never been heard. It's an issue about 52 million Kenyans. And the issue at hand is enough to bring the change we want in Kenya. Regardless of movement, affiliations, what language you talk, whether it's Seth Panyako at the top there, Seth Panyako talks like us activists, our language. So let's get our comrades and power to you. Mimi sitaongea zaidi hapo. I just want to say power to you because it's upon you. It's upon you. Tuacha kuulizana hizi maswali. Tuacha kuulizana hizi maswali. It's enough.
Thank you. Derito, briefly.
Democracy and rights under the lockdown. You know, the other day I was talking to a friend and he was telling me the problem with Kenya is democracy or the semblance of it. We are, the government of Kenya is comfortable for us to be able to sit here and critique it and question it, knowing very well that that conversation will not go beyond that point. That's why activists nowadays, you can say whatever nobody will lock you down. Nobody will take you to Nyayo house. You can have your space and talk. And he was saying that is our greatest undoing, because he was saying, had it been a situation whereby you have no voice, the reason why Uganda is what it is right now and people have a voice is because, and people are rising up is because they have no voice. He was saying we have too much voice in Kenya that does not lead to any meaningful action. Why? Because the government is immune to the noise. We seem to make noise, then at the end of the day, we go back to our hustles, we go back to our families, we go back to nobody is angry enough to want to die for this country. And that's why sometimes you organize protests and you only get a handful of people. Because mtu wako, lazima nirudie familia yangu. Wacha hiyo ni story yao. So, active citizenship is something that we all need to have it collectively, not look at it as something that when activists, quote unquote, those that we know are activists, and we say that ni kazi yao, it has to be something. Being an activist is simply having a voice. Having a voice is simply having a mouth and having an opinion. And raising it. That's what activists do. They have an opinion, they have a mouth, they raise it.
And they inform themselves.
And they take time to study, to learn, you know. So I don't know how we get out of this cocoon of democracy or the semblance of it. We think we are free, we think we are capable, but in essence, our freedom and information does not lead to tangible results. The conversation of healthcare, or rather, let me talk about, we've said healthcare and how bad it is more of a governance issue. For how long have we been talking about governance in this country? For how long have we been talking about being able to elect the right people in office? And every time we have an election, we think like, now we have it. Because usually we are, and this is, you look at your constituency or whatever is your area of representation, we hardly vote people in. We are always looking to vote people out. Hatutaki fulani. Najua, nobody even sit down to critique huyu mwenye tunaleta ni nani. It's usually hatutaki fulani. And we are always voting people in. If we are going to move forward, we need to be very deliberate about the kind of governance we choose for this country, about the kind of people we have leading us. And when our voice, how we use our voice, when Uhuru appoints a PR guy to lead a ministry of health, and then we only realize it after he has mismanaged the COVID situation. That's why we are saying, now by the way, insurance agent, you know. So young people, we have to understand that the issue largely is of governance, and moving forward, we need to be either the change or agitate it in a more meaningful way. Thank you.
Thank you so much. I think this has been a really fruitful, emotive discussion, and I'm thankful for the panelists. I'm sure that we will want, in the future to have a follow-up conversation and see this conversation that we had today, how, where are we taking it, and just like, if I could echo your words, saying that we need to be that person, to be that change, and begin collecting leaves in the field from where we are. And I like that, Njoki, you said one of the things is that we talk a lot at each other. It's your fault, it's my fault. I think it's saying, okay, we are in a sinking ship. You are the captain, but okay, fine, we're sinking. What do we do? How do we both live? How do we both survive? And I think even as we live here, we should ask ourselves, what, as individuals, what is your right to health? What do you feel? Do you feel your right to health has been infringed on? What things can you do? Can you talk to your local authorities? Who can you talk to? How can you plug into what any other person is doing, and not necessarily, here, even outside of this space. I think when we look at a rights-based approach to healthcare, even if we look at what we call universal healthcare, we should look at something that addresses marginalized and at-risk populations, addresses vulnerabilities, and looking at the issue of equality versus equity. Equality is saying you have two hands, you have 2 feet, we can both, equitably compete. However, when you look at socioeconomic, the situation that socioeconomic factors put us in, there are some of us who are quote unquote more able than others. We can stretch people can stretch their hands further. The other thing is also to focus on legislation, looking at our rights holders, looking at what laws, discussing, creating caucuses that we can push these things forward. In a special way, as I wrap up, I'd like to thank the Embassy of Sweden, Nairobi, and also Forum Civ and various sponsors of this event and partners and stakeholders. And kindly, let's continue this conversation on social media. Tell us what you think, where you think we should go, and how you think we should get there. Thank you so much, and asante.
I think the panel and the moderator deserve a round of applause. Mr. Nderitu Muya, Betty Waithera, Stephen Okwani, Njoki Gashanja, thank you so much for your time and knowledge sharing with us here. And those who have been following us, we've been live on Facebook. And Dr. Andrew Kamau, thank you so much for such a brilliant moderation. If we just take a step here, we'll have a group photo as we close the session this morning. You are the Democracy and Human Rights Festival 2020. Organized by Forum C with the support of the Swedish Embassy. And this was our 4th panel session. We've been holding events since Monday. Monday and Tuesday, we were at the Kenya Cultural Center. Today, we have moved to Alliance Francaise. And this morning discussion has been centered around the right to healthcare and access to healthcare in COVID times. But I think it went very broad because healthcare is a very, very central, this is a question of life and death. It's like bread and butter issues. So I think even the responses and the questions that we were getting from the audience, there's clearly a lot that needs to be done. And the only way such major changes can be achieved is if we collaborate, we bring our efforts together. We have the activists, we have the doctors, we have non-government organizations, we have various other partners coming together so that we can make a push to improve healthcare situation in the country. Asanteni sana, sana, sana for joining us today. And as they take a step to have a group photo, we are going to invite a musician, Apesi, who will come and wrap up the session for today, for this morning rather. In the afternoon, we will be having a discussion on the question of how we tackle the widening inequalities in the country. It's going to be a very, very powerful discussion. We're expecting some very notable individuals working in the activist space, working in political education, who are going to be joining us from around 2:30. So if you're available for that, those in the audience, as well as those at home, you can follow us live. It will be live on Facebook, as we've been, and you can send your comments and any other information you'd like us to receive through the hashtag Democracy and Rights Festival. Asanteni sana. I think Mr. Luobo is ready with his camera to have a photo as Apesi also steps up to give us 1 or 2 songs, and then we will close the morning session. Mr. Apesi, a musician from Kisumu, who has been with us since morning. And he was also sharing to us about his interest in activism and his attempt to use his creative talents to effect social change in his community. So as he just prepares to give us a musical interlude, we're actually closing this morning session. We've been live on Facebook, the Democracy and Human Rights Festival 2020. And in the afternoon, we have a session from 2 p.m. that will be canvassing issues on how we can narrow the widening inequality gap in the country, an issue that I'm sure many of you here, as well as those watching us from home, would be interested in following that discussion. So, Mr. Apesi, it's on to you. Karibu sana.
Yeah, there's something that Webber said that inaanza na sisi. What are you doing at an individual level? Unafanya nini? And what I can add, naweza uliza how I wish to come up together and to say, for example, where you are an activist, na maybe area yako ni about human rights, but you are seeing chenye nafanyika on health na daktari. Mbona tusibonge same lugha ama tusionge in one voice? How I wish tunaweza work together.
Mbona twaishi kwa njia mbaya? Mbona twaishi kugana? Mbona twaishi tukidanganyana? Haifai kuwa namna hii. Hauwezi sikia kwa sauti ya huyu msanii anataka jue kweli. Hauwezi sikia kwa sauti ya wananchi wanataka haki zao. Hauwezi sikia kwa sauti ya huyu msanii anataka ukuwe huru. Afrika ya Afrika ya yelele Apesi ya Apesi ya yelele Oeba ya Apesi ya yelele. Nasema sikia, nasema sikia, imeandikwa nafsi yangu itauja. Wana wa kike watatabiri na wa kiume watapata maono. Kisha nitafanya maajabu kwenye mbingu, ishara kwenye nchi kavu za damu, moshi na moto. sikia, yelele, nasema sikia, oh sikia, nasema sikia, oh. Hawezi sikia kwa sauti ya yule mama mboga, anataka haki yake. Hawezi sikia kwa sauti ya huyo msanii, anataka jue kweli. Hawezi sikia kwa sauti ya mwananchi, anataka haki zake. Afrika yo, Afrika yo, yelele, Kenya yo, Nairobi yo, yelele, Kisumu yo, Kisumu yo, yelele, nasema sikia, nasema sikia. Hawezi sikia kwa sauti ya sisi wananchi, hatutaki BBI.
Because mi nauliza wangapi wamesoma BBI? Na wangapi wamesoma hata BBI tu kwanza? Aya. If umesoma, kuna any part ina talk about the youths, maybe ina talk about art. So ni kitu una support kitu hata uelewi, unaona? So mi usema at most of the time as artist, as wananchi, lazima upate information, no? Ni poa kujua. Wanasemanga lack of knowledge, unaweza potea juu ya lack of knowledge, si ndio? So I'll do one more song. So most of the time you upenda culture, yani ningependa tu kuwapeleka tu kidogo. Spirituality, mimi na believe in spirituality, si religion. Kukua tu unajua unafanya kitu right. About spirituality, anaitwa Winyo. Thanks.